Yan.
So yun ba kahit akala namin hindi pinapasok?
Kala namin, sir, kala namin di ka pinapasok sa baba. Mainit. Mainit. Mainit ulo na Secretary Duque. Yan. Okay. Good morning. The Committee on Health and Demography is hereby called to order. Before we start, let me acknowledge the presence of uh, Senators Nancy Bina, our Senate President Tito Soto, Senator Nancy Binay, Vice Chairperson, Senator Rizon Tiveros, Senator Panfilo Lacson, Senator Tolentino, Senator Bato de la Rosa, Senator Joel Villanueva, Senator Kiko Pangilinan. We have a very pressing matter to discuss in our agenda today. We have here the members of the Interagency Task Force on Emerging Infectious Diseases, other concerned government officials, and health experts to give us an update on the novel coronavirus outbreak and the measures we are taking to contain this virus. May we request the Committee Secretary to acknowledge the resource persons present today. Ms. Committee Secretary, kindly.
Yes, sir. Hello, good morning. We would like to acknowledge the resource persons for this morning's hearing. From the WHO, Dr. Rabindra Abia Singh. From the National Government Agencies, Executive Secretary Salvador Medialdea, Secretary Martin Andanar, Secretary Francisco Duque III. From the RITM, Director Celia Carlos. From NEDA, Secretary Ernesto Pernia, Secretary Carlos Dominguez III of the DOF, Secretary Eduardo Año, Secretary Teodoro Locsin Jr. of DFA, Secretary Silvestro Bello III of DOLE, Secretary Leonor Magtolis Briones of DepEd, from the Department of Tourism, Secretary Bernadette Romulo Puyat, from the DTI, Secretary Ramon Lopez, from the DOTR, Secretary Arthur P. Tugade, from the Department of Justice, Secretary Menardo Guevara, from the Bureau of Immigration, Commissioner Jaime Morente, from the OWA, Andrelin Gregorio, Director, from the Manila International Airport Authority, General Manager Eddie Monreal, from the Civil Aeronautics Board, Attorney Carlo Arcilia, from the Philippine Ports Authority, General Manager J. Daniel Santiago, Secretary Delphine Lorenzana of DND, from the PNP, Lieutenant General Camilo Pancreatus Cascolan, Deputy Chief for Administration, from the PhilHealth, Brigadier General Ricardo Morales, from the Philippine Society for Microbiology and Infectious Diseases, Dr. Marisa Alejandria, from the National Institutes of Health of UP Manila, Dr. Eva Marie Cotionco de la Paz, Dr. Richard Mata, Dr. Paul Salandanan, Dr. Solante, Dr. Ronchine Solante, from the League of Cities of the Philippines, Janelle Rabe, from the Philippine Medical Association, Dr. Jose P. Santiago, from 3M Philippines, Mr. Keith Rodan, Asia Pacific Regulatory Development Manager, Public Safety Division, from the DSWD, Secretary Rolando Joselito Bautista, from CHED, Commissioner J. Prospero de Vera III. Thank you.
Thank you, Committee Secretary. Last week, the World Health virus epidemic in China as a public health emergency of international concern. After the Chinese government itself declared of the disease has been accelerating, we knew we had to act fast, but of course, this must be not done lightly. We also have to take into consideration the views of international organizations and our very own health experts. As Cornelius Tacitus, senator and historian during the inspection and delay. Falsehood by haste and uncertainty. Last night, the members of the Interagency Task Force for the Management of Emerging Infectious Diseases, other health experts, and key government officials had a briefing with President Rodrigo Duterte to discuss the government's response to this worldwide health concern. I was invited as the chairperson of the Senate Committee on Health and Demography. Kasama rin po doon si and my counterpart in the House of Representatives. Since day one, the Duterte administration has said that they have been on top of the situation and are doing everything they can to address the issue. The President and even a key official from the World Health Organization has commended the efforts of this government in responding to this worldwide health concern. Allow me also to take this time to emphasize that despite criticisms, the President believes that this government has acted swiftly and has made timely and informed decisions to protect our country. Gayunpaman, gamitin natin ang pagkakataon ito para makinig at makatulong. Hindi naman po basta-basta lang ang pag-decide sa mga ganitong klase ng problema. Kailangang masusi ang pag-aaral at evidence-based po ang ating mga desisyon. Ito ang rason kung bakit tayo nandito ngayon sa public hearing para maintindihan kung ano ang sakit na ito, alamin ang ginagawa ng ating gobyerno at magrekomenda ng mga pulisya upang mapangalagaan ang kapakanan, interes at kalusugan ng bawat Pilipino. Unang-una, ano po ba itong nCoV, acute respiratory disease? It seems like all countries are vulnerable as of today. At least 25 countries have nCoV cases. What can the government do to step up its efforts and ensure that this virus will not spread here in our country? Though it has lower fatality rate compared to previous coronaviruses like SARS and MERS, what are the risks we are facing? It is important that we understand the problem for us to address it and provide solutions. Nandito ang DOH, WHO, and other health experts to explain this and educate our policymakers and the general public on what exactly we are dealing with. Pangalawa, ano po ba ang ginagawa ng ating gobyerno? What are the precautionary measures the government has been taking since day one, and how were these implemented? Sapat ba ang ating ginagawa? At may pagkukulang man, paano natin ito iayos? Pangatlo, ano po ba ang guidelines na mayroon ang gobyerno para maintindihan ng publiko ang mga pulisya ang nakalatag ngayon? Specifically, the President already imposed a temporary travel ban on travelers coming from any part of China and its special administrative regions upon recommendation of DOH and members of the Interagency Task Force. Ano po ba ang epekto nito sa ating mga kababayan, lalong-lalo na po sa mga OFWs natin na nasa China o galing China pero umuwi sa Pilipinas ngayon? Paano natin sila mapapangalagaan? We cannot please everybody. The WHO did not declare an outbreak immediately and did not even recommend a travel ban. Despite this, the government imposed the temporary travel ban as an additional precautionary measure to protect the people in our country. Dapat bantay sarado din natin ang lahat ng mga possible points of entry. If public health and safety demand, the general welfare of the Filipino must prevail. Pang-apat, may repatriation plan ba in place na po ba para mailayo sa kapamakan ng ating mga kababayan na nasa Wuhan at iba pang apektadong lugar? We should also stand ready to assist Filipinos in China who are willing to voluntarily return to the country. We must not only have our facilities ready to accept them, we must also put in place all the necessary support mechanisms and measures not only during the duration of the quarantine but also thereafter. Ang panglima, let us also take into consideration all factors involved that would affect our country. What is the impact of this worldwide health concern to our economy and the lives of millions of Filipinos here and abroad? As the President emphasized last night, this is not only a concern of the Philippines. This is not only about China. This is a worldwide concern that needs a community approach. Hindi po ito panahon na maging xenophobe. Panahon po ito para magmalasakit sa bawat taong apektado sa buong mundo. I wish to emphasize that we should not be singling out Chinese nationals. We empathize with China given that they are going through, but we are putting these precautionary measures in place to protect the country and its people. As part of a community, the Philippine government should be committed to assist other affected countries address this worldwide health concern. Before our colleagues here start asking questions, allow me to take this opportunity to express my trust and confidence in the Department of Health led by Secretary Duque and other concerned agencies. I know that you are all working double time to address this current threat. Not only those who are present here today, but every health worker and practitioner who has sacrificed fellow Filipinos. Secretary Duque, medyo tone down lang po yung babalita mo dahil natatakot minsan yung Pilipino sa boses mo, sir. Sa ating mga frontliners sa gobyerno, mga airport personnel, immigration officers at kapulisan, madalas kayo ang unang tumatanggap ng kritisismo at reklamo, pero nandyan pa rin kayo para gampanan ang inyong mandato para sa bayan. Maraming salamat po sa inyo lahat. I would like also to remind everyone levels of government. We ask our agencies to lay down and communicate their plans properly to better inform and educate the general public and the media about the virus and the precautions that we are undertaking to combat it. Sa oras ng krisis, kailangan maintindihan ng tao ang nangyayari at maiwasan ang fake news. Magtulungan tayo para pakalmahin ang mga tao. Huwag na dumagdag sa panik. Yung mga panay dada naman dyan, para lang makapagsalita, mga bashers na sumasakay sa sitwasyon para sa pansariling interes, mga taong gusto lang magdulot ng panik, ang mga nagpapakalat ng fake news, kayo ang dapat i-quarantine para hindi kayo makahawa. Sa mga trolls at bashers, punta kayo, pumasok na kayo rito. Sumali kayo dito sa public hearing. Pakiusap ko po, tumulong na lang tayo. Unahin natin ang kapakanan, kalusugan at interes ng bawat Pilipino. Sa mga panahong tulad ngayon, ang kinakakaba natin ang magiging kalagayan ng ating pamilya at mga mahal sa buhay. Dapat ay mas magtulungan tayo, magkaisa, magbayanihan tayo para sa ikakabuti ng bawat Pilipino. This is a very emotional issue for all of us, but I appeal to everyone for your cooperation. We have our officials here and our health experts to provide us answers. We are doing this because we care for your families and for our country and the worldwide community. Alalahanin niyo po, inuuna ni Pangulong Duterte at ng gobyernong ito ang kapakanan, interes at kalusugan ng bawat Pilipino. Bilang siya ang tumatayong ama nating lahat, concerned po siya sa kapakanan ng kanyang mga anak. Nakikinig ang Presidente sa hinaing ninyo, pero ang desisyon niya ay base na rin po kung ano ang tama at kung ano ang makakabuti sa pangkalahatan. Binabalanse niya ang lahat. That is why we elected one leader. We chose one leader to decide to lead our country, especially in these trying times. Once again, I would like also to assure the Filipino public that the government is doing its best to respond to this worldwide health concern. We are treating this concern very seriously, as the very health, safety, and lives of our families also depend on it. So you can rest assured that the concern we have for the Filipino is the same as the concern we have on our very own families. I would like to
Salamat, Mr. Chair. Magandang umaga po sa inyong lahat. Laman ng balita ngayon na nagkakaubusan na ng alcohol at surgical mask sa mga tindahan. Such shortage is a worrying symptom of the panic that has swept over our people in the past week, with the news that the 2019 novel coronavirus has finally reached our shores. Plagues and diseases are as old as humankind. So do the rumors and hoaxes that swirl around them. The digital age, social media in particular, has given misinformation a wider reach. Ang kailangan natin ngayon, a reassuring voice that is able to get itself heard above all the noise and conflicting opinions. Bilang kasapi ng pamahalaan, alam kong dapat maging voice of reason ako. Hindi nagpapadala sa mga haka-haka, hindi nagpapadala sa takot. Ngunit aaminin ko bilang isang ina, isang magulang, nangangamba ako. What we are facing is something new. We do not know how contagious the coronavirus could be or how deadly. Sa ganitong mga pagkakataon, nabubuo ang mga agam-agam at takot ng tao. The primary reason that moved me to file Senate Resolution number 293, calling for an inquiry into our government's response to the 2019 NCOV, is so we can provide reassurances while we have yet to find a cure. At para rin makahanap tayo ng solusyon kung meron pang pagkukulang sa response natin sa threat na ito. Government has to step up, but even now, we are dealing with indictments from the public. Ang pakiramdam ng marami, naghahabol tayo. We are being reactionary instead of ideally being proactive. Dapat inuunahan natin ang mga issue na posibleng lumitaw. Have we identified a viable quarantine facility, or is self-quarantine effective? Are we prepared in the event of an outbreak of the virus? Will our hospitals have the capacity to treat our people? Are we making sure that our response is guided by the desire and indeed the sacred duty of government to serve the people that it represents? Ito ang mga tanong na nais maisagot ng ating mga kababayan. At inaasahan natin na mabibigyang linaw sa hearing na ito. On the policy-making side, I'm also interested to find out whether it will be possible for us to implement a fully funded pandemic response infrastructure. Kung makakapaglatag tayo ng ganitong klaseng whole-of-government approach sa pagtugon sa sakit na may measured response sa halip na tapal-tapal. Mabibigyan natin ng peace of mind ang ating mga kababayan. Dahil hindi lang naman coronavirus ang kalaban natin ngayon. Tandaan ho natin, nandiyan ang problema natin sa polio, measles at iba pang mga sakit. Ang hearing po na ito ay hindi para magturuan, magsisihan. Ang hearing po na ito ay para magsama-sama ho tayong maghanap ng solusyon para malabanan itong problema ng coronavirus. Muli po, maraming salamat Mr. Chair at magandang umaga po sa inyong lahat.
thank you, Senator Binay. Senator Joel Villanueva will give his opening statement and to be followed by Senator Rizal.
Thank you very much, Mr. Chairman. Pagpalang araw po sa ating lahat. Wala pong nag-akala na sa pagsimula nitong taong 2020, haharap po ang ating bayan sa napakabigat na pagsubok. Ngayon, tila naging top basic need ng mga Pilipino ang alcohol at face mask. Gaya ng nabanggit ni Senator Nancy, nagkakaubusan na nga daw po ng surgical mask dahil hindi naman po siyempre sanay sa ganitong demand ang mga local manufacturer natin. Ang taas po ng demand mula pa noong January 12 nang pumutok ang Bulkang Taal at nagtuloy-tuloy dahil na rin po sa coronavirus outbreak. Ang report nga po sa atin, kahit sa mga probinsya, inuuna pa ngayon na hinahanap ang face mask at alcohol kaysa sa bigas. Karamihan ng mga eskwelahan ay nire-require na rin ang mga bata na mag-face mask. Maganda po ito na nag-iingat at proactive ang lahat. The tendency these days is to hope for the best but prepare for the worst. And this is what we want to achieve in filing Senate Resolution number 291. How we should act, what we should do, where can we go for medical attention and correct information, what can we do about these worries and concerns. We need practical, preventive, curative, and realistic measures to respond to this public health threat. We'd like to put on record and commend the distinguished gentleman from Mindanao, our chairperson, Senator Bongo, for calling this hearing. And of course, our Senate President, Senator Tito Soto, na mabilis na nag-abiso at tumawag ng meeting para siguruhin na ang mga pumapasok din po dito sa Senado ay ligtas at maalagaan ang bawat isa. Mr. Chairman, we wanted to ask a lot of questions and raise a lot of issues. Specifically, for example, sa DOH. Ano nga po ba ang capacity of our 70 DOH-supported hospitals which are already somehow, and according to news, ay overcrowded na din even prior to the 2019 coronavirus outbreak. Our point is, we have limited resources. Kung marami ng patients under investigation or PUIs, San Lazaro for example, hindi na po ba magagamit ang hospital para sa ibang sakit ng mga Pilipino? At yun nga po, magkukulang talaga ang mga personnel, resources, at facility natin. Tama naman po talaga yon na mapag-usapan at masiguro natin na may magagawa po tayo at gagawin. At habang tumataas po ang bilang ng mga PUIs, nagkakaroon din po siyempre ng banta sa kalusugan ng ating mga manggagawa sa mga frontline service at mga hospital. We also need precautionary measures at our workplaces. The good thing is that we already passed into law the Occupational Safety and Health Standards, or OSH law, thanks to our colleagues present here today. Because under this law, all employers are required to keep their workplaces safe and healthy, not only for our workers, but also for the general public. Let me reiterate that non-compliance with occupational safety and health standards is a crime. Buhay at kalusugan po ng ating mga manggagawa ang nakataya sa pagpapabaya ng mga employers. I'm glad that the Dole family is also here because we want to know from them the extent to which our employers provide information about NCOV, monitor the health of their workers, and provide personal protective equipment or PPE, most especially to our healthcare workers. Other than OSH, we also expect our friends from Dole to urge the private sector to adopt telecommuting for workers whose tasks can be done remotely to minimize possible spread of the disease. Ito po ay ilan lamang sa mga pwede nating magamit para makatulong sa DOH na mapigilan ang pagkalat ng NCOV. Now, as regards to the travel ban, there are some specific issues we would like to raise. For example, since transmission from asymptomatic persons is a reasonable possibility, should the response of the Philippine government be reassessed or be recalibrated, especially since border checkpoints may be rendered useless if the infected persons are asymptomatic. Ito po yung mga nag-bother na katanungan sa amin at kanina nga po pinag-uusapan ng mga senador dito, paano nga ba makakatulong iyon kung asymptomatic nga? Kung pumasok, hindi naman po sila madedetect. Questions like, are we ready? Binanggit kanina ng Senator Nancy. Kung sakaling mag-repatriate na po tayo ng mga OFWs, how are we preparing for that? Kung meron na po, dasal natin, wag naman sana. If it happens na may Pilipino na po na magkaroon nitong NCOV, what can we do? Ano po ba ang economic impact nitong mga nangyayari na ito? Maaaring apektado ang turismo, although we feel na yung domestic tourism ay buhay na buhay pa naman po. Pero alam natin lahat na di hamak na malaki ang nawawala sa atin kung tayo pa ang mamumroblema sa mga dayuhang PUIs. Lalo na kung mahahawa po ang mga manggagawa natin sa mga hotels, restaurants, resorts, airline at airports, transportation at ang general public. Ito pong mga ito ang ating nais pag-usapan at muli tayo pong lahat ay naririto para makinig, para makiisa at makatulong sa bawat isa po na naririto, lalo na sa mga executives na naririto. Maraming salamat po sa inyong presensya. Maraming salamat, Mr. Chairman. God bless us all.
Salamat, Senator Villanueva. Next is
Salamat, Mr. Chair, at salamat, Sen. Joel. Mr. Chair, I'm in this hearing today not only as a legislator, but as a concerned mother and as a concerned citizen. Bihira lang po ito mangyari, but I do genuinely welcome the President heeding the call to impose a China-wide temporary travel ban. I was one of the first to recommend it. Siguro sa usapin ng public health emergency and preparedness, we should all be on the same side. Ang pangunahing dahilan kung bakit ako nanawagan ng temporary China-wide travel ban, Mr. Chair, is to give time to our local health authorities to properly set up safeguards in our health systems to effectively respond to the 2019 nCoV. Ngayon, nakakalungkot at nakakabahala at the same time na ang pinakaunang namatay sa nCoV sa labas ng China ay nasa Pilipinas. I think this hearing should boil down to one thing. Handa na ba tayo? We don't want our countrymen and women to panic. That's why we have to assure them and answer the most fundamental question. Are we prepared for the worst? At kapag ka, Mr. Chair, kinilala niyo na po ako para makapagtanong, yan po yung patutunguhan ng aking mga tanong. Sa ilalim din ng RA 11332 o yung Mandatory Reporting of Notifiable Disease, na isa po akong co-author, na may kinalaman lalong-lalo na sa pagtatalaga ng mga epidemiology and surveillance units o ESUs sa buong bansa natin. Nang sa gayon, kung sakali mang maging malubha pa ang sitwasyon natin dito sa Pilipinas tungkol sa 2019 nCoV, ay tayo nga ay mas tiyak na maging handa, makapagresponde at magawang ligtas at malusog yung ating mga kababayan. Salamat kaayo, Mr. Chair.
Thank you, Senator Riza. All right, at this point, let me lay down our ground rules for this hearing. To have an orderly discussion, we will allow questions from my fellow senators by order of their arrival. Senator Soto, as our courtesy to our Senate President, to be followed by Senator Binay, Senator Hontiveros, Senator Tolentino, Senator Lacson, Senator De La Rosa, Senator Villanueva, Senator Pangilinan, Senator Drilon. Due to our limited time and to give all senators here a chance to ask, we will only allow 5 minutes per senator to propound questions. Answer of resource persons will not be counted in the 5-minute time limit. Kindly approach the rostrum once it is your turn to ask questions. While we welcome manifestations, recommendations, and criticisms in this hearing, we wish to humbly request that we stick to the most crucial topics that this committee needs to address, namely, number 1, the nCoV acute respiratory disease. Number 2, precautionary measures the government is taking. Number 3, implementation of the travel ban. Number 4, repatriation plan. And number 5, the tourism and economic impact. The chairman reserves the right to interject questions. With the indulgence of my fellow senators, before our questioning and statements, we shall first hear the presentation of the World Health Organization, followed by the presentation of the Department of Health. Go ahead, Dr. Rabi. You may start your presentation. We'd like to recognize our Senate Majority Leader, Senator Migs Subiri. Go ahead, Dr. Rabi.
Thank you for this opportunity. Senate President Vincent De Soto, Honorable Senators, representatives fellow colleagues from the Philippine government. Thank you for this opportunity. While the present, okay, thank you. I will present to you the sequence of how events evolved and the timelines. It's important to understand this, and I will also talk a few things about what we know about this disease. This is a new disease. Many questions are not clear at this point of time. We are working very closely both within the WHO and with international partners to understand this disease better, and we acknowledge the good support we have received from the government of China and its institutions in these efforts. So let me start, and as I go along, I will explain how things evolve. Next slide, please. A very brief update on the number of cases. These were the numbers that were reported to us at WHO yesterday evening. That shows 17,391 cases reported. I'd like to inform you that the numbers this morning have now risen to 20,438. The vast majority of these cases, in fact 99% of the cases, are within the People's Republic of China and its special administrative regions. Of the 20,000 cases, approximately 2,788 cases are classified as severe disease. The 2019 nCoV acute respiratory disease causes severe disease and can result in death following respiratory and renal failure. However, the number of patients developing severe disease, as you can see, is less than 20% of all confirmed cases. To date, my slide shows 361 deaths reported. To date, we have 427 deaths reported. All of them have been within the People's Republic of China, and one death that was reported. As of today, there are 23 countries that have reported confirmed cases across the world. Based on this information, the WHO has classified the risk within China as very high. Of how this situation has evolved. Next slide. December. The 1st of December, and on the 1st of January 2020, since the cases were concentrated around the Hunan seafood market in Wuhan city, the market was shut down. I want to clarify here that although this is called a seafood wholesale market, what was for sale was not only seafood. There were many exotic meats, among other things, for sale at this market. This is important to understand the following events. Next slide. On the 7th of January, the China National Health Commission informed us that they had isolated a novel coronavirus as the cause of this pneumonia outbreak. I want you to focus on the timelines. This is since the 30th of December to the 7th of January. It's important to realize that within 7 days, the Chinese authorities identified the cause of this outbreak as a coronavirus. This is important because in comparison to the 2003 SARS outbreak, isolate the pathogen, right? So this is tremendous progress in regional and global preparedness to deal with an unknown emerging disease. Next slide. On the 11th of January, the first death was reported in Wuhan city. Again, I draw your attention to the fact that till the 11th of January, nobody suspected that this outbreak of pneumonia could cause deaths. This date is important because by the 31st of January, WHO declared this event a public health emergency of international concern within 20 days. By the 12th of January, China shared with WHO and globally the whole genome sequence of this new coronavirus. And the virus was formally designated as the 2019 novel coronavirus. Explaining in layman's terms, the whole genome sequence means the molecular structure of this coronavirus. It's important to understand that because this structure helps to develop tests for identifying whether somebody is infected by this virus. Again, I'm stressing the dates. It's only on the 12th that we had with us the whole genome sequence, and based on that, the ability to test for the presence of the virus. Next slide. On the 13th of January already, using that data that China shared, Thailand confirmed the first case of this virus outside of China, but in a traveler coming from Wuhan. Next slide. On the 16th of January, Japan confirmed its first case. Next slide. By the 19th of January, the Republic of Korea reported 1 case, and for the first time, there was confirmation of cases outside of Wuhan and Hubei province, in Beijing and Guangdong. Next slide. On the 20th of January, there was the first reports of infection in healthcare workers in Wuhan city, China. Again, I draw your attention to the timeline, 20th of January. Until then, the perception was that this disease is caused from a food source, because coronaviruses are normally associated with meat, and the assumption was, because it was concentrated around Wuhan, that people had eaten some meat there. It was only on the 20th of January when health workers at the Wuhan hospital were infected, and this was confirmed, that the first evidence that this could possibly be transmitted from a patient to another person emerged. Important timeline again. This is so much that we didn't know about this disease that is now coming to light. Next slide. On the 24th of January, there were 835 cases reported. The vast majority were within Hubei province. And at this stage, there were isolated cases being confirmed from all of the provinces of China except Tibet. China has 23 provinces. Next slide. On the 30th of January, the WHO Emergency Committee for International Health Regulations, convened by the Director General, declared this a public health emergency of international concern. Due to timeline differences, that happened to be 31st of January, Manila time, because it happened late in the evening in Geneva. Again, it's an important timeline. I want to also explain that the DG summoned the emergency committee for the first time on the 22nd of January to review this incident. And the emergency committee is actually not WHO staff members. It's a committee of global experts that are selected based on the emerging health threat that is being reviewed. And the emergency committee necessarily includes a member from the country affected. That means an expert from China. So on the 22nd, when they met, the evidence available was inadequate for the emergency committee to make a conclusion. And they asked for further evidence, and they reconvened on the 23rd of January. However, at that time, there was no clear evidence to classify this event as a public health emergency of international concern. But recognizing the anxiety and concerns of member states, the DG requested the emergency committee to be available to be reconvened at short notice. And on the 30th of January, they were reconvened, and they came to a conclusion that based on increasing numbers of cases within China, increasing numbers of deaths within China, and the presence of cases in several other countries. At that time, I believe it was 12 other countries, including, for the first time, confirmation of person-to-person transmission outside of China in 4 countries: Germany, Japan, Vietnam, and the United States. The emergency committee decided to classify this event as a public health emergency of international concern. At this time, when this was so classified, the outbreak was causing about 25% severe cases and close to 3% deaths. However, and I want again to reiterate this, because in comparison to the Middle East respiratory syndrome, which was also caused by a coronavirus, the mortality rate was not 3% as in this case, but 34%. So even though there was low mortality, recognizing the diversity in healthcare capacity across member states and their possible capacity to deal with this outbreak, and also acknowledging the very significant, possibly unprecedented measures being adopted by China to contain the spread of this disease, including a lockdown of a city of nearly 9 million people in Wuhan that has never been done in global public health, WHO decided that it is now time to classify this event as a global public health emergency. And the purpose of this was to ensure that we can contain the spread of this disease and mitigate its impact in other member states. That was the purpose. Reaching this conclusion, the emergency committee and WHO concluded that we still believe that this outbreak can be controlled, like the previous 2 coronavirus outbreaks of SARS and MERS-CoV, but that we need to increase the preparedness and response capacities across all member states so that they are prepared to deal with possible importations and the possible emergence of local transmission. This has been our focus not just after the emergence of this outbreak. Since the SARS outbreak, especially in this region of the Western Pacific region where the Philippines and China are both, WHO has been working very closely with member states using the Asia-Pacific Strategy for Emerging Diseases to strengthen country capacities and readiness to deal with these situations. Next slide. Next slide, please. So I want to summarize the impact. Who is affected? Who dies? Next slide. We look at the data. This data is about 3 days old now, but about 70% of cases are among people above 40 years of age. 64% of the cases have been males. About 40% of the cases had some underlying pre-existing medical condition. Oftentimes that was diabetes, high blood pressure, cardiovascular disease, or cancers. Next slide. The deaths. I have revised this based on current data. The death rate now is at 2%. Yeah, so the death rate is now going down because we are testing more people who are less severely affected, who have mild symptoms. And in this scenario, we are seeing that the percentage of deaths is about 2%. 88% of this are in individuals over 60 years of age, with a median age of 75 years and an age range of 48 to 89. I draw your attention to the death here in Manila. The individual was 44 years. 76% of the deaths have been among males, and 70% of them have had pre-existing medical conditions. Next slide. So, based on all of these facts and what is evolving, the risk, as I mentioned, in China has been classified as very high, regionally and globally as high. Next slides. WHO now acknowledges that there is clear evidence of human-to-human transmission. It is important for us to recognize, and I want to explain, that the vast majority of transmission to date is acknowledged to be happening from symptomatic sick people. I am clarifying this because there are lots of reports, and I heard it from Senator Villeneuve also, about the concern of asymptomatic transmission. We do have reports from China that the disease could be transmitted from asymptomatic people. But, and this is not surprising for a coronavirus infection. This was also there during the MERS-CoV outbreak. But we like to clarify that the evidence to date is that more than 90% of the transmission is actually attributed to symptomatic people, right? So that is why we are advocating that people with respiratory symptoms and signs need to be careful, need to practice cough etiquette, need to wear masks, everybody needs to wash hands frequently, because if you're coughing and your droplets contain this coronavirus, it can, the virus could be present on utensils, on home items where an infected person has coughed. Again, I want to reassure you that the evidence suggests that the virus can survive on those surfaces only for a few hours, something between 8 to 10 hours. Um, so if you have somebody sick who is having respiratory symptoms, make sure that you make an effort to clean surfaces that are handled by those people. This is an infection prevention measure, particularly in facilities that we are managing PUIs or confirmed cases until their reports are available. But it's also good practice during flu season to do this. So again, our focus is that by frequent hand washing with soap, if you haven't access to water and soap, to use an alcohol containing sanitizer. I hear your concerns. People have bought up everything on the shelves, but that's another question. What we are advocating is, and WHO has clearly provided and shared information on the use of masks. We don't see a benefit of masks to be used by the general public. We continue to advocate that people who are having respiratory symptoms, people who are dealing with large numbers of public, who are exposed to possible risk, who are in crowded places, could be wearing those masks at that time, but it would be preferable to reserve those masks for high-risk individuals, including health workers. This is important now if we are to prevent secondary transmission, especially from PUIs and in outpatient departments of hospitals. So our message is that we need to be rational about the use of masks. Factually, it shows that non-symptomatic people using masks, it will give them a false sense of confidence and put them at more risk because they tend to wash hands less. So it's more important that they wear the mask properly if they are symptomatic and that they wash hands regularly. Just because you wear a mask, you should not neglect keeping your hands clean. Because if you touch the mask and you have droplets on the outer surface of the mask that somebody else coughed on, you could still get infected. So what is more important is actually hand hygiene, right? Next slide. So we recognize the diverse impact this problem could have on health systems and countries with different levels of socio-economic development and capacities within health systems. I reiterate again, WHO has been working with member states to improve their preparedness and response capacities. I want to mention here that Philippines is one of those countries that have been proactively over the last few years building its response capacities to face such eventualities. Next slide. So, in light of this emerging threat and the evidence that we know about this situation, WHO is continuing to work with the Department of Health and other concerned government and non-government entities in the Philippines to prepare your response capacities and your preparedness capacities, to heighten them based on what is known about this disease. Next slide. A little explanation about a public health emergency of international concern. This is not an easy decision. It has implications. And WHO recognizes that events should not be easily classified as public health emergencies of international concern. The DG explained this very clearly during his press conference and in subsequent communications from headquarters. And this is a very serious recommendation that WHO takes, because it provides WHO with the capacity to implement a coordinated response to an extraordinary event that requires a cross-border response through the mobilization of additional resources both within countries and across countries through the participation of international partners and donors. Next slide. So I will summarize the recommendations from the emergency committee that pertains to countries that will help prepare and increase their preparedness. Next slide. So the emergency committee and WHO recommends that countries prepare for containment through strengthening active surveillance, meaning looking for cases, early detection through strengthening laboratory capacities. We commend the Philippines that the Research Institute for Tropical Medicine already has the capacity to test for this virus. Isolation of suspected or persons under investigation and case management. Contact tracing and prevention of contacts through isolation of suspected patients and mitigation of the effects of the infection through improved case management. Next slide. The recommendation also places emphasis on reducing human infection, preventing secondary transmission, meaning if you have an infected person, you need to isolate that person so that a second person doesn't get infected, and to prevent further international spread. Next slide. Collaborate and actively participate in increasing knowledge on the virus and the disease. The disease is now classified as 2019 novel coronavirus acute respiratory disease. Next slide. We remind countries that member states are legally required to share information with WHO under the international health regulations about possible cases, confirmed cases, and deaths. This helps WHO to better understand the threat level posed by this situation to individual member states and the global community. Next slide. WHO on the 31st of January did not recommend travel or trade restrictions. However, this recommendation is not binding because countries are sovereign to make decisions based on the travel patterns with the affected country and based on its health system capacities to deal with the possible threat. Next slide. However, we encourage countries to inform WHO of any travel measures taken so that these can be shared with other member states so that we may minimize social and economic disruption. Next slide. So that's the legal basis for that measure. I believe that's all. Next slide. Thank you. So in summation, I want to commend the Department of Health for its leadership and the government of the Philippines for its proactive measures. As I mentioned, WHO announced that this was a public health emergency of international concern on the 31st of January, according to Philippine time, and by the 2nd of February, you had implemented a travel ban, among other measures. Of course, even before this, right from the announcement of the outbreak in China, the Philippine Department of Health, supported by WHO, was strengthening its preparedness and readiness and response capacities. And we continue to work with the Department of Health and the government to prepare their response capacities. We are encouraged by what we have seen. There are still measures that the country is implementing, and WHO stands ready across its 3 levels of country, regional office and headquarters to support those efforts, and we reassure the public in the Philippines to stay calm that the measures being implemented and by the government of the Philippines and recommended by WHO are, we believe, adequate to control this outbreak. Thank you, sir.
Thank you, Dr. Rabi. Let us now hear from Department of Health. Go ahead, Secretary Duque.
Thank you very much, Mr. Chairman. In behalf of the Department of Health and the Interagency Task Force on Emerging Infectious Diseases, we greet a pleasant day to the Senate President, the Chairman on the Committee on Health and Demography, and the honorable members of the Senate. And joining me are the members of the Cabinet, led by our Executive Secretary, and all the other agencies constituting the task force on emerging infectious diseases. And my fellow public servants, isang magandang araw po sa ating lahat. Again, good morning. I'd like my presentation today will cover the following points. First, some information about what the coronaviruses are in general, and in particular the novel coronavirus, which is now briefly referred to as the 2019 nCoV. But if you are attributing the disease to it, it's the correct term is the 2019 nCoV ARD, or the acute respiratory disease. The second part of my presentation would be to highlight the local or the Philippine situation, which is embodied in the timelines of very important events that have so far transpired. And third would be contextualizing the virulence of the 2019 nCoV infection against other coronavirus infections. And it's good to reiterate, even if it's been very clear in the presentation of Dr. Rabia Singhe, the country representative of the WHO in the Philippines. And of course, lastly, I would like to highlight the actions taken by our DOH and our advice to the public. So let me just characterize the coronaviruses first. These refer to a large family of viruses belonging to the family Coronaviridae. And these viruses cause illness ranging from the common cold, which you and I every now and then experience, and to more severe diseases like the Middle East Respiratory Syndrome, or the MERS-CoV, and the severe acute respiratory syndrome, or the SARS-CoV. The 2019 nCoV is a new strain. Coronaviruses are zoonotic, meaning they are transmitted between animals and people, and as confirmed recently, human to human as well. Patients who contract the coronavirus were shown to exhibit respiratory symptoms such as fever, cough, shortness of breath, and breathing difficulties. In more severe cases, the infection can cause pneumonia, as what has happened to the first or the second case of novel coronavirus patient who died in the Philippines. This is an imported case, and I'd like to underscore that this is an imported case. The acute respiratory syndrome and kidney failure are also complications at the extreme end. Again, because the 2019 nCoV is a new strain, there is no vaccine against it, no specific treatment yet, except supportive care. Now, as of February 3, 2020, this have been shown. We can move on. Suffice it to say that the current statistics would show that the case fatality ratio for nCoV has so far gone down from 3% to 2%. That's a good one-third reduction just over the last few weeks. And of course, several other ASEAN countries also have confirmed cases, but WHO, like China, we are considered very high, well, high risk for transmission. This in contrast with high risk only for the entire Western Pacific region and the globe. Just to put things in perspective, the case fatality rate of nCoV is much less than SARS-CoV and MERS-CoV. However, it is more easily transmissible, as you can see on the slide. This map shows the distribution of the 80 persons, or rather patients under investigations reported in the Philippines. Note the spike in number of the persons under investigations is attributed in part to the expansion of travel history criteria in our case definition from those who have traveled to Hubei to include those who have been to China and the contact tracing activities. The number of reported cases per region are as follows: 3 cases in Ilocos, 1 case in Cagayan, 15 cases in Central Luzon, 27 in Metro Manila, 4 in Mimaropa, 8 in Western Visayas, 11 in Central Visayas, 1 in Eastern Visayas, 5 in Northern Mindanao, and 5 in Davao. Of the 80 PUIs, 67 are currently admitted and isolated, while 10 have been discharged under strict monitoring. Again, 2 mortalities were reported. One is a confirmed case, and the other from a patient under investigation who, however, tested negative and was immunocompromised that gave rise to pneumonia that he eventually succumbed to and died. And the immunocompromised individual, I have to be a bit more blunt about this, test, 3 tests revealed an HIV/AIDS case. In the next few slides, allow me to share the key events surrounding the 2019 nCoV and the Philippines' whole of government response led by the DOH and the task force. Before 2019 ended, as you can see on the screen, WHO observed a clustering of pneumonia cases in Wuhan City, China. By January 6, DOH ordered strict checks on incoming travelers. On January 7, China has identified the new type of coronavirus previously not identified in humans. On January 11, the DOH urged the public with a history of travel to China to seek immediate medical consultation. The next day, the whole genome sequence of this virus was shared by China to the WHO and the public and was designated the 2019 nCoV. On the same day, DOH investigated the report of a 5-year-old case of pneumonia in Cebu City. This is a child who came from Wuhan City together with his mom. On January 17, DOH met with partners to discuss national capacity for 2019 nCoV and reported the 2019 nCoV health events. Thereafter, DOH implemented the mandatory accomplishment. We reinstituted the health declaration cards for all port arrivals because at some points this was stopped. And on January 20, the next slide, the DOH established the 2019 nCoV task force. China reported cases of human-to-human transmission. On January 21, the DOH released health advisories and issued the interim guidelines on the preparedness and response to the CHDs. On January 22, the DOH issued the guidelines for 2019 nCoV response through a department memorandum on strengthening of hospital infection prevention and control measures to prevent the spread of 2019 nCoV. The Chinese authorities locked down the city of Wuhan on January 23. Following this, Philippine airports and seaports were placed on tight watch. The Civil Aeronautics Board indefinitely suspended all operations from Wuhan to the Philippines, while Marina advised ship owners and operators with regard to the nCoV. On January 24, we received the test results of the 5-year-old boy in Cebu and tested negative for 2019 nCoV. On January 27, your DOH coordinated with DFA and discussed foreign concerns relative to the novel coronavirus. On January 28, DOH ups communication of the novel coronavirus by launching the daily case tracker and dedicated website page www.doh.gov.ph/2019nCoV. DOH has likewise announced regular press briefings nonstop with an average of about 30 media interviews and daily, almost daily press briefings, which are held for the benefit of the public and to give them the latest updates. On the same day, the DOH convened the first interagency task force meeting on emerging and infectious diseases meeting. Recommendations from the said meeting included voluntary repatriation of Filipinos and travel restrictions for individuals coming from Hubei province. Following this, the Bureau of Immigration suspended visa upon arrival for affected Chinese nationals. On January 29, DOH convened all the CHD directors for a command conference and concerned chiefs of hospitals and directed all DOH units to attend to all persons under investigation and monitoring for 2019 nCoV infection who seek consultation and treatment. On January 30, the DOH confirmed the first 2019 nCoV acute respiratory disease case in the Philippines and initiated contact tracing. LTFRB directed all drivers and conductors of public utility vehicles to wear face masks while on duty. DFA issued a public advisory calling for the voluntary repatriation of Filipinos in Hubei. On January 31st, WHO declared the 2019 nCoV as a public health emergency of international concern. On the same date, the second interagency task force meeting for the management of emerging infectious diseases was held. On a Saturday, the IATF-EID operationalized the directive of the chief executive to temporarily ban foreign nationals from China and approve repatriation and quarantine plans for the DOH. On February 2, DOH confirmed the second case of the novel COVID ARD in the Philippines and has reported the first death in the world outside of China. Again, this is an imported case of novel coronavirus that succumbed to pneumonia. And February 3, the President has called for an emergency meeting on the 2019 nCoV ARD, which was attended by the DOH and principal members of the IATF-EID, Committee on Health, chairpersons of the Senate, Senator Bongo, and the House of Representatives, Congresswoman Tan, and other infectious disease experts, where the President's clear directives were as follows. Number one, to make sure that there will be a regular inventory of isolation rooms, not only in the public sector healthcare facilities, but equally important, the private sector isolation rooms must also be ready. Second is to ensure that there will be a dedicated transport vehicle to ferry patients from the communities, assuming that there is going to be a community spread. But knock on the wood, I hope that doesn't happen. But just the same, we have to be proactive and we have to be indeed ready for that eventuality. And so that is why the President has underscored the importance of a dedicated transport vehicle and not use the other ambulances for transport for fear of contamination. And of course, there has been also highlighting by the President of scaling up the diagnostic capacities, not only of the Research Institute of Tropical Medicine, but last night we have come to an agreement that all the laboratories of our tertiary private hospitals will very quickly be accredited based on stringent standards for the testing of the novel coronavirus. And lastly, the President has also approved in principle the budget of 2.25 billion pesos for the procurement of personnel protective equipment on the assumption that there will be 5,000 healthcare workers who will need this, and there will be 500 or 1,500 pesos. Well, I'll be lost in the computation. I can just give you the computation later. This is going to be on the assumption that this will last for 90 days or 3 months, and multiplied by 3 shifts, because the care will have to be round the clock, cannot be just for 8 hours. And the total amount would be 2,025,000,000 plus, of course, 10 million pesos worth of surgical masks. And allow me to just backtrack a little with regard to the PPE. The PPEs will include the headgear, the goggles, the N95 mask, the gloves, the apron, the gowns, which is costed at about 1,500 pesos per set. On the same day, the President reassured the public with transparency that the Philippine government is capable indeed of addressing the 2019 nCoV situation. And this is not the first time, Your Honors, we have been besieged by the similar coronavirus of 2002 and 2003, and as well as the MERS-CoV in 2014 and 2015. So we've done this before, but it is very important that we should be able to heighten all the interventions needed to respond, to mount an effective response to these evolving or emerging infectious disease. And what the challenges are that are observed with this particular novel coronavirus is this particular virus can be notorious for its ability to mutate. And to what extent this virus is going to mutate, nobody knows for sure. And that is why we have to be extra careful, and we ought to be ready at all times. And finally, I'd like to just highlight the protection interventions or measures that the DOH has been doing. Even with the confirmation of the first and second cases and PHEIC declaration or global health emergency, our advice to the public remains: practice frequent hand washing, avoid unprotected contact with farm or wild animals, practice proper cough etiquette, maintain distance of no less than 1 meter, and cover coughs and sneezes with a tissue or the crook of your elbow. Avoid close contact with people showing cold or flu-like symptoms, and ensure that food is well cooked. Travelers with symptoms of respiratory illness, either during or after travel, are urged to seek medical attention immediately. All health facilities are to enhance standard infection prevention and control practices, especially in our emergency triage departments. And we must always be ready, as I have underscored. We sincerely hope that the Senate can help the DOH disseminate accurate information better and support us in our request for a supplemental budget. This is the end of my presentation, and again, pleasant day to one and all.
Thank you, Secretary Duque. Secretary, just one more presentation. I believe Secretary Dominguez has a brief presentation. Go ahead, Secretary Dominguez.
Senate President Vicente Soto, Senator Christopher Bongo, Chairman of the Senate Committee on Health and Demography, Honorable Senators Miguel Zubiri, Franklin Drilon, Coco Pimentel, Nancy Binay, Risa Ontiveros, Panfilo Domingo, Ronald de la Rosa, Joel Villanueva, Francis Pangilinan, Amy Marcos, and Francis Tolentino, Senator Ping Lacson, members of the Cabinet, fellow workers in government, good morning. Thank you for inviting me to today's hearing. This year, opens with a few major challenges to our economy, and we have to take stock of their potential aggregate impact on our economic performance. These are the African swine fever, or ASF, the eruption of the Taal volcano, and the global spread of the novel coronavirus. We have been dealing with the ASF since last year. The effort to contain this epidemic is spearheaded by Department of Agriculture. Until cases surfaced last week in Mindanao, the incidence of the disease had been mainly concentrated in Central Luzon. Containing the ASF required culling infected pigs and safely disposing of them. To date, the Department of Agriculture reported that the number of culled pigs has reached 193,350. This led to losses for swine cultivators and a decline in the value of our hog production last year by 9.5% compared to the preceding year. We continue to successfully intercept contaminated pork imported from other countries through the Bureau of Customs' intensified anti-smuggling campaign and the Bureau of Animal Industry's heightened meat inspection efforts. Last January 24, the two agencies intercepted 25 tons of meat from Guangzhou, China, which tested positive for ASF. The disposal of the contaminated meat started on January 31 and is currently ongoing at the Integrated Waste Management Facility in Cavite. Furthermore, the Bureau of Customs Customs has also filed cases against entities that were caught smuggling goods contaminated with the disease. The Department of Agriculture is strictly enforcing biosecurity measures and setting up more quarantine checkpoints, as well as providing more disinfection facilities to manage, contain, and control the spread of ASF. Zero interest rate loan assistance programs will also be given to affected hog raisers. We reiterate the announcement made by the DA that ASF is non-transmittable to humans and that pork is safe for consumption. Meanwhile, ongoing activity under the Taal volcano could still result in a more explosive eruption. However, unless and until this actually happens, we can only speculate on the full impact on the economy. As of January 20, estimates from the National Economic Development Authority show that the total foregone income in the economic sectors due to the eruption could reach 6.6 billion pesos, or 0.26% of the 2018 gross regional domestic product of Region 4A, or Calabarzon. The bulk of the foregone income comes from agriculture and fishery sectors, services, and industry. Short of a major eruption, the damage to our crops and the challenges of dislocated communities to which the government will continue to respond will not significantly impact our overall growth projections. We are confident that the Department of Agriculture and the concerned government units are fast-tracking the release of production support, agri-fishery aid and livelihood assistance, and cash or zero interest rate loan assistance programs to the affected farmers and fisherfolk, as well as the implementation of the recovery and rehabilitation plans of the affected areas. The 2019 novel coronavirus, on the other hand, might very well be at an early stage of its global outbreak. So far, 99% of the infections and a large majority of the casualties have been confined to Hubei province in China. The government of the People's Republic of China has mounted an unprecedented effort to contain the spread of this virus. We acknowledge the determined and comprehensive efforts of the Chinese government towards containing this virus. To date, the only death that occurred outside China has unfortunately happened here, and although it involved a traveler carrying the virus directly from Wuhan. While the World Health Organization has not recommended travel restrictions, the Philippines, along with several other countries, is enforcing a ban on travelers from China and its special administrative regions. President Duterte has also ordered the establishment of a repatriation and quarantine facility. Given that we may be in the early stages of this outbreak, it will be a challenge to estimate the cost of its potential economic costs. We are consoled by the observation that the virus has limited local transmissions outside China. As we continue to implement proactive measures to keep our people safe, the global medical research community is working on identifying a cure. A significant impact on the economy will most likely be centered on the tourism sector. The travel and tourism industry around the globe is taking a hit as a result of the various levels of travel bans imposed by national governments and of voluntary decisions of airlines to cut flights to and from China. What has transpired in the aftermath of the outbreak of the SARS H1N1 and MERS CoV may give some preview on how the current novel coronavirus outbreak will unravel. During the SARS episode, tourist arrivals to the Philippines dropped by 1.3%, from 1.93 million in 2002 to 1.9 million in 2003, according to the Philippine Statistical Yearbook. But in 2004, tourist arrivals rebounded quickly by 20.1%, totaling 2.3 million for that year. Subsequently, tourist arrivals had increased continuously until the H1N1 outbreak in 2009, which resulted in a slight decrease in arrivals. Note, however, that the world economy at that time was reeling from the effects of the global financial crisis, which is likely to have had a larger impact on tourism. The Philippine tourism also proved resilient during the outbreak of the MERS CoV. It is worth noting that even with fewer arrivals in 2003, tourism direct gross value added actually increased by 8.8% compared to the previous year due to increased average spending per tourist. In the last few years, however, our tourism direct gross value added has been rapidly rising, mainly due to a substantial increase in arrivals from China. While travel restrictions are enforced to protect the health of Filipinos, tourism's direct gross value added will likely decrease. It is still too early to ascertain the economic effects of these efforts to safeguard our people, but the Department of Tourism will provide periodic updates as the situation evolves. The DOT has committed to continue aggressively looking for opportunities in partnership with all tourism stakeholders to sustain the gains our country has made. The agency will intensify the promotion of domestic destinations for local travelers who have decided to postpone or forego international travel for the time being. Meanwhile, the lockdown imposed by the Chinese government on Wuhan, which is considered the hub of transport and industry for central China, could create some supply problems that will affect trade and industry elsewhere. Factories have temporarily ceased operations due to the lockdown. Other factories in China are likewise just restarting operations after the long Lunar Year holiday. A few have predicted economic disruption on a major scale, but at this point it is too early to estimate the full economic impact. China has been the Philippines' top trading partner. Last year, more than half of our exports to China were shipments of electronic parts. In the immediate term, the temporary closures of factories in China and possible disruption in global supply chains may cause a temporary slight decline in our exports, particularly of electronics and auto parts. Incidentally, our top imports from China, such as steel, machinery, and petroleum, are products that do not seem to carry the NCOV virus, though we will continue to take all necessary precautions. the Department of Industry and Trade has committed to work closely with affected Chinese and China-based companies who will be looking to strengthen their operations by adding a production site outside China. While these developments may dampen our growth somewhat, domestic tourism is expected to increase as more people would likely prefer to travel within our borders, thus boosting domestic consumption. With our Build, Build, Build program firing on all cylinders this year, complemented by a benign inflation rate and a stable monetary policy, we expect the economy at large to sustain its momentum. Rest assured, we are continuously monitoring these developments and will regularly update the legislature. At this moment, it is reasonable to expect that while these developments might slightly restrain our economic expansion, these threats are not enough to force a dramatic reduction in our growth estimates. We are standing by our working projection of a GDP growth rate between 6.5% and 7.5% for 2020. Thank you.
Thank you, Secretary Dominguez. Would like to acknowledge the presence of Senator Amy Marcos and Senator Coco. Senator Coco ba? Hindi kita nakilala. Senator Coco Pimentel. Anyway, may we know from the Executive Secretary what are the directives of the President to address the 2019 novel coronavirus? Go ahead, Secretary Medjaldea.
Mr. Chairman, before I would proceed on the directive of the President vis-a-vis the coronavirus, may I just read a note for the committee. First of all, I would like to thank the committee and its members for the opportunity to present the real situation and the government's efforts to contain the coronavirus. As you can see, all the secretaries of the concerned agencies are here not only to put to rest any worry that senators may have, but more importantly, assure the Filipino people that their government is working to contain this virus. If the honorable senators would allow, we would like to get your support in sharing to the public that they too have a responsibility in their government's efforts to prevent the spread of the virus, from the simple washing of the hands and practicing good coughing etiquette to complying to self-qualitative rule for travelers. We need the cooperation of all. Sama-sama tayong sugpuin itong virus na ito. The Filipino is stronger than any calamity or virus it may face. Thank you, Mr. Chairman. Now, may I proceed with the directives given by the President?
Go ahead, Secretary Medjaldea.
Immediately when the World Health Organization declared that this is an international emergency, the task force on the Interagency Task Force for Management Emerging Infectious Diseases in the Philippines met and recommended to the President, who approved the following measures. 1, a temporary ban against the entry of any person except Filipino citizens and holders of permanent resident visa issued by the Philippine government coming from Hubei province as well as other places in China where the spread of the 2019 coronavirus has been officially confirmed. Number 2, a temporary ban against the entry of any person except Filipino citizens and holders of permanent resident visa issued by the Philippine government who within 14 days immediately preceding arrival in the Philippines has been to Hubei province as well as other places in China where the spread of the 2000 coronavirus has been officially confirmed, and those traveling from China via Hong Kong. Letter C, a mandatory 14-day quarantine for Filipinos and holders of permanent resident visa coming from any place in China. Letter D, temporary ban of Filipinos from travel to Hubei province, as well as other places in China where the spread of the 2000 coronavirus has been officially confirmed. And lastly, the establishment of a repatriation and quarantine facility somewhere in the north, still being studied and considered at this point. That's all, Mr. Chairman.
Thank you, Secretary Medjaldea. Anyway, to Secretary Duque, it has been confirmed that the virus can be passed from human to human. Can the virus survive on the surface of inanimate objects such as cargo or shipment coming from affected areas? Isa po ito sa concern ngayon, aside dun sa tao, kung i-contain natin yung i-isolate natin yung tao, quarantine natin yung tao, how about the cargos? Yung tanong na yan kasi sabi nyo 8 hours yung survival period nung virus, pero itong cargo na darating dito, paano natin sila mako-contain? Pag hinawakan ng taong possible ba na mahahawa rin po tayo? Tulad yan dito sa Senado, nag-meeting po sila kahapon, di ako naka-attend. Pinatupad muna nila yung bawal muna yung kamayan. So, paano ngayon, SP? So, si Senator Drilon, Duterte feast muna siya ngayon. Bawal daw hindi rin, hindi yan. Feast ba? Hindi pala. Ma'am. Anyway, pakisagot lang po, Secretary Duque.
Maraming salamat po, Ginoong Chair. Yung pong cargo, yung mga container vans, pagka nabilad po ito sa araw, yung pong virus ay posibleng mamatay dahil heat labile. Pangalawa po, ang ating pong pinaka available information is that yes, the novel coronavirus can survive and stay for as long as 10 hours on inanimate objects like the surface of the table or computer keyboard, the telephones, the fomites, which would include the handkerchiefs, the beddings, pillowcases, the foam, etc. From few hours to several hours, and I think the latest information is up to 10 hours. So, yun lang po ang masasabi natin at there have also been information coming our way that the virus can be difficult to inactivate or to neutralize when the climate, when the temperature is low and when humidity is also low. So, tuyo at malamig, yan po ang medyo mas mahirap ma-neutralize yung novel coronavirus.
Ibig sabihin, anong temperature po siya kayang mapatay yung virus?
Unfortunately, Chairman, hindi po masabi yung talagang with accuracy kung ano po yung temperature. It's just generally stated in the literature, kapag malamig daw po at saka tuyo, doon medyo may kahirapan na ma-neutralize. Pero dito naman sa Pilipinas, alam po naman natin na relatively speaking, we have a much warmer climate, mas mainit po sa atin at maumido. So palagi ko ito ay makatulong.
Baka sa init ng ulo ng mga tao dito, kaya bang patayin yan? Anyway, and then another question. Itong sa proper use of the face mask ngayon. How about you, Dr. Mata? Can you Sige po, ipakita niyo po. At saka yung shortage nitong mask. Bakit iba yung itsura ng mask mo sa mask ni Senator Coco? Meron din. You may stand up. Dito, you may use the restroom. Dr. Mata, question lang po. Sa katanungan ng karamihan, ang may sakit lang ba ang kailangan magsuot ng mask o kahit na walang sakit? Kasi nagkakaroon tayo ng shortage sa mask ngayon kasi sabi nila nagpapanik buying. Yung iba naman po hindi raw kailangan magsuot. So ano ba ang dapat? Ano ba kailangan suotin? Yung isa, yan mas manipis o yung N95 ang dapat?
Okay, for the question on N95, yung power po ng N95 is talagang steel po siya. So if I wear this way, as you can see,
Yun ang nasa hospital, yung mga N95. Kasi mas maraming stock yata yung ordinary na mask.
Yes, cheaper ang surgical mask. Much expensive ang N95.
To Secretary Lopez, ina-address nyo na ba yung shortage at saka yung setting the standard retail price nito at wala pong hoarding? Hinuhuli nyo ba yung mga nag-hoarding nito?
Yes, Mr. Chairman. Nung umpisa pa ho, about 2 weeks ago, we started to monitor first the prices and then the supply of surgical masks. So at that point, ang ating SRP, also as prescribed by the DOH, nandun tayo sa 1 peso to 8 pesos per mask. And we were able to catch about 18 violators, and inisyohan po yun ng notice of violation, and all those notice of violation after 48 hours will be converted into the filing of charges against them. So they are now being heard at the Fair Trade Enforcement Bureau, can be subjected up to about 300,000 penalty per store, per violation. The current problem is less on the price but on the supply. Marami ho talaga nag-out of stock simply because of the sudden the surge in the demand. Marami talaga nag-demand. Some can be considered panic buying. And the normal inventory ng ating mga drugstores are not that high. But once na out of stock, these drugstores would normally, of course, reorder to refill their inventories. Now, the recent feedback that we're getting from the drugstore, even their usual suppliers, nahihirapan na rin silang kumuha because abroad, even in other countries, kailangan din nila yung supply. So not all are able to supply them with the desired quantity. So the government had an initiative proactively search for its own suppliers or sources. And the main source that we were able to talk to over the weekend was the lone producer, manufacturer of the mask, itong surgical mask, based in Bataan. Isa po siya exporter talaga. But they've been in the country for the past 41 years, and they really have been supporting the country. In fact, during the Taal eruption, nagpa-donate din sila 500,000 masks at that time. And then for this, because of this problem, the government's discussion with them, they committed to supply first 100,000 immediate supply, actually to be delivered today, which we would prioritize to give to the DOH. Dahil ang initial requirements talaga priority yung mga nasa frontline po natin, mga health workers, as requested by Secretary Duque. And then that supplier also committed, at least they have the capacity to supply and commit to the Philippines 400,000 pieces per week. And so that is what we intend to add on to the local supply. Initiate lang po yung government kasi nakita namin na pati yung private sector, they're having a hard time sourcing the supply. Importante, we have stocks or supply here in the Philippines. So once they bring the stocks to us, we will make it available first to the DOH and then one half to the DOH and one half to the public through the drugstores para ma-distribute natin. So in a month, we can commit about 1 million pieces for the public and 1 million pieces for the DOH requirement. And that can go on as long as we need the stocks. Thank you, Mr. Chair.
Thank you, Secretary Lopez. Can our health and medical experts we invited here confirm if they concur with the statements of Dr. Mata about the proper use of the mask? May we call Philippine Society for Microbiology and Infectious Diseases, Dr. Marisa Alejandria, and is she here? Annalisa Ong Lim, also a medical expert, and Dr. Edsel Salvana from the National Institutes of Health of UP.
Good afternoon, Your Honor. Senator Bongo, Senate President Tito Soto, honorable senators. Yes, I concur with the wearing of public masks, but with additional information. I'd just like to emphasize again that those who are healthy, immunocompetent, meaning wala hong ibang sakit, hindi buntis, hindi nagkikimotherapy, hindi po kailangan mag-mask. Kung ngayon, sa sitwasyon na may nCoV tayo, kung hindi naman din kayo galing sa China o sa mga bansa na merong confirmed cases, hindi kailangan mag-mask kung walang simptomas. Ang advisory sa mga travelers na galing China ay mag-quarantine ng 14 days. So that's mandatory para ma-contain po natin ang virus, para hindi siya mag-spread sa community. Going back to how to wear the mask, okay, importante din po na naghuhugas pa rin ng kamay. Pagkasuot ng mask, yung tamang pagtanggal, huwag niyong hahawakan yung harap. Ang pagtanggal, yung nasa tenga, yun ang hahawakan pag tinanggal. And then, wash your hands. Pag madumi na din, palitan na siya. No? Hindi siya pwedeng for the whole 24 hours, suot-suot yung mask. So, kailangan tatanggalin. Papalitan na pag madumi or 6 hours. At tama po na ang magmamask ay yung pasyente, yung may ubo, sipon. So, that's our public health responsibility. If we have cough, colds, kahit na hindi coronavirus, dapat magkonsulta or magmask. Kasi hindi lang naman coronavirus ang matatransmit natin kung tayo ay inuubo or sinisipon. May iba pang mga infection na pwede tayo makuha. Okay. So, yun po yung sa mask. Tapos yung N95 naman, sa ospital po, hindi naman lahat ng nasa ospital, yung mga employee ay kailangan naka-N95. Yun lang pong healthcare worker directly involved in managing or treating patients, or especially the suspected cases of nCoV. Tsaka may mga iba rin po tayong sakit na ang healthcare worker ay nag-N95. Kami po, pinoprotektahan din namin ang sarili namin. So may mga guidelines kami dyan kung kailan kailangan naka-N95. Yan po. And then, I'd like just to say also that it's very, very important yung quarantine kasi nga wala pang local transmission. So, 2 cases natin imported. So, we really have to exert all efforts to contain the virus so that it does not spread in the community. So, how are we doing that? So, yun nga yung So we welcome very much the travel ban kasi because of the volume of travel, lalo na marami tayong Chinese tourists. So there's a lot of risk there of getting the infection. So yung mga travelers from China, important po yung 14-day quarantine. And pag sinabing quarantine, nasa loob ng bahay. Yung mga asymptomatic, walang symptoms, dapat sa loob ng, hindi sila lalabas ng bahay for 2 weeks. Yun yung kailangan sundin as a public health responsibility so as not to spread the infection. Tapos yun namang may symptoms ng travelers within the 14 days, dapat magkonsulta at sila yung magmamask. So yun po yung kailangan nating i-implement sa atin, mga kababayan.
Thank you. For a while, Senator Riza Ontiveros. Anyway, I would like to acknowledge Governor Dakila Carlo Cua, National President of the Union of Local Authorities of the Philippines. And I believe the Executive Secretary wishes to be excused because he has another engagement. Thank you, Secretary Majaldea, for attending this hearing. Now, I have one last question, very important one, to Secretary Anyo. I know your time is also very precious. have you already issued directives and guidelines for local government units to prevent the spreading of this virus, the possible spreading of this virus?
Yes, Mr. Chairman. In fact, even before the declaration of the WHO on the public health emergency of international concern, we already issued advisory to the local government units and formalized a memo circular dated January 31 for our local government officials, particularly the governors, the mayors, and the barangay captains, to spearhead the information dissemination, to act as the crisis manager, and to be in charge in preventing the spread of the coronavirus, particularly at the level of the barangay. The mayors organized the barangay health emergency response teams led by the barangay captains, and these barangay health emergency response team shall be in charge of imposing the mandatory quarantine, 14 days, for all citizens arriving from China and its special administrative regions. And for those who manifest symptoms, immediately they will be transferred in coordination with the interagency task force to DOH designated novel coronavirus referral centers. And likewise, in coordination with the DOH, the use of an ambulance that is solely dedicated for people manifesting the coronavirus symptoms. This is actually in line with the interagency task force and with the declaration of the President. So we deal only with citizens who came from these areas, China and its special administrative regions. But for those manifesting symptoms, they should be immediately transferred to these designated coronavirus referral centers, Mr. Chairman.
Thank you, Secretary Anyo. We'll just ask my other questions later. SP President Senator Soto.
Thank you,
You have the
Mr.
floor.
Chairman. Thank you. Mr. Chairman, I will not ask any questions. Instead, I'd like to focus on the concern of my concern and some other members of the Senate and, of course, our people, of the unknown origin as quoted by the WHO. So, meron tayong kasabihan eh, you want to defeat an enemy, know the enemy. So, ano ba itong virus na ito? I have received a report concerning this particular measure, this particular disease, and I'd like to show the video. Anyway, it is a little over 10 minutes. But after the video, I'd like the comment of Secretary Teodoro Locsin Jr. On the video itself. So please pay close attention to the video. I think it's somehow very interesting, if not revealing. May we have it, please? Kaspi audio.
Mystery surrounding the coronavirus becomes denser and denser by the day. As doubts arise about its origin and everything seemingly points to biowarfare being waged against China. According to the medical journal The Lancet, the first case of infection dates back to December 1, 2019, and the person infected had not been to the Wuhan fish market. Further critical points have also been raised by some independent journalists. Now we know that in the Wuhan biolab, the Chinese were experimenting with a modified SARS virus for military purposes. At least 3 other countries have been doing the same for years: the United States, Russia, and China. We found 3 news in this regard. The first news dates back to 2014, and it announces the construction by China and France of a biolaboratory for the research on infectious viruses in China. And guess in which city it was built? None other than Wuhan. The second news, which is connected to the first as of 2015, in which the Preparedness Institute, a British government-funded pharmaceutical company, asks and obtains a patent for the coronavirus, that can also serve according to the patent as a vaccine to prevent respiratory lungs disease such as contagious bronchitis. The third news is about the Bill Gates Foundation funding biotech companies that are trying to develop vaccines against the deadly Wuhan coronavirus. Bill and Melinda Gates Foundation and others predicted up to 65 million deaths via coronavirus, in simulation ran just 3 months ago. I wouldn't be surprised if both the US military and the CIA were directly involved in the development of the deadly coronavirus strain. Bear in mind, the 2014 Ebola outbreak came as a result of another rogue US military operation in Africa in which the Soros-Gates-funded Kenema bioweapons lab in Sierra Leone was involved. Surprisingly enough, this rogue U.S. military operation came shortly after Mark Lambert's appointment as the new U.S. ambassador in the United Nations, as an effort to prevent and thwart China's aggressive influence over the UN Security Council's future decisions. And John Bolton. What was he doing at the Gates meeting? Welcome to the Atlantis Report. Everything apparently points to biowarfare being waged against China. The culprits are the Western powers, namely the US and Britain. The objective is to put stress on China in a combined effort to contain her growing power and influence. The tool, the coronavirus. The best bioweapons are not going to kill everyone immediately. They burn through too many hosts and die out. Best to make a virus that infects everyone and causes the infrastructure to fail with massive numbers of the sick. Kinda what is happening in China right now. Look at Ebola, it kills too fast and dies out relatively quickly. Coronavirus, officially called the novel coronavirus 2019 nCoV. Its contagion is a respiratory illness, a new type of viral pneumonia, in the same family of infections as SARS and MERS. It is highly contagious, up to 2-week incubation in patients with no symptoms. Just the perfect recipe for a global outbreak. I doubt any country is prepared for this. Wuhan, a city of 11 million, is completely shut down, is estimated to have over 25,000 confirmed cases and over 43,000 infections. Wuhan lockdown doesn't really help to stop spreading in other major cities in China. Chongqing can be the most affected, followed by Beijing, Shanghai, Guangzhou, Shenzhen. China has over 50 million people on lockdown right at this very moment, just give that a little bit of thought. Over 50 million people. And by the way, China is always lying about figures and statistics. The coronavirus is way more grave than they make it seem. Millions of Chinese are stuck in cities in complete lockdown. The first case in Germany was just reported. By now it is spreading across the States and Europe. Meanwhile, most stocks are hovering around their all-time highs. Remember that after the SARS breakout we went down to -40%. And SARS was nothing compared to this one. This is the moment to prevent getting a hit with your pension money. I suspect there will be follow-up releases until desired population levels are achieved. If they release this, there is nothing stopping them from releasing engineered smallpox, Marsburg, anthrax and so on. Or God knows what kind of chimeras they have created. And rising speculation it was engineered could be steered by the US as an accidental release from the Level 4 facility 20 miles from the fish market. Extremely slick. Wonder if she has it figured out. Probably. It's a dead certainty Putin has. Another article by the blacklistednews.com reports under the title, "Did China Steal Coronavirus from Canada and Weaponize It?" Last year a mysterious shipment was caught smuggling coronavirus from Canada.
would they do that? Maybe the plan is for China to create a virus so strong they will first test it on themselves. And when they are all dead, then they will spread it to other countries. Second, other suspect, US. The US has done this because they can send it all across the ocean into Wuhan and kill the Chinese. But then later on, the other suspects are Canada. But at any rate, it says it will also spread to US and Europe. Again, this is a plot of the United States and the West to destroy China by first destroying itself. This is really clever. So I don't know if you can believe this, but on the other hand, let me say that there is no truth that China even withheld information about this disease. On January 7, Hong Kong consulate received the news from the Hong Kong government that on January 4, it had already released its preparedness and response plan for novel infectious disease of public significance. Before the discovery that you could isolate it, China was already spreading the news to all its administrative regions, who were then authorized to tell us that this is happening. 3 days later, they discover the isolated virus. In short, even before they were sure of it, they were already warning everyone. Second, from that point on, China was already warning us, and I assume warning all the other consulates and embassies about the progress of this disease. And it goes on day to day, all the way down to the 27th of January when, my first reaction when this came out and I was asked, what will you do about it? I said, the Department of Foreign Affairs consists of civil servants who are diplomats. We are incompetent to address a disease. Therefore, we are putting ourselves under the direction of the Department of Health, and all its orders will be followed by DFA throughout the world. We will not listen to anybody else in the government, including ourselves. So, from that point on, you had unity of command. Now, let's...
Anyway,
yeah.
It's good that you have expressed your opinion on the matter, because this is circulating, and I and many others who are here in the Senate are not ready to take in the contents, hook, line, and sinker. And it is best that we are also aware of what other people are saying concerning this coronavirus.
Yes, Mr. Senate President.
Is there anything else?
In fact, Mr. Senate President, there is no doubt that there are people abroad in the West who are perhaps happy that this is happening to China, because this may spell the end of Chinese power. Unfortunately for them, if that is true, this disease is only proving the resilience and strength of China. In 10 days, they have a massive containment facility. That's only shows how strong that country is. This challenge will actually not weaken China, but will strengthen it in the eyes of the world as a power that just cannot be defeated even by nature. Thank you.
Thank you, Mr. Chairman. I have no further questions. I'll leave the questions to our colleagues on the matters.
Thank you, Secretary Locsin, SP Soto. Next is Senator Nancy Binay, Vice Chairperson of Committee on Health.
Thank you, Mr. Chair. Secretary Duque, tama po ba na napakahalaga doon sa containment itong contact tracing?
Kasama po yan sa protocol natin. Talaga pong mahalaga ang contact tracing, lalo na doon sa mga nagkaroon ng mga sintomas, katulad po ng dalawang Chinese nationals. Ito po ay ginagawa ng ating Epidemiology Bureau Surveillance Officers, at meron po kaming report na ibabahagi sa inyo kung ilan na po ang kanilang naabot na mga pasahero o mga mamamayan sa mga iba't ibang lugar kung saan nakasalamuha o nakihalubili ang ating pong dalawang mga Chinese patients. Ano, yung isa nga po pumanaw, pero ganun pa man ay sa ngayon ang mga contact tracing na ginawa ay sa eroplano, sa hotels and resorts, hospitals.
Secretary Duque,
Yes, sir.
doon ho sa aeroplano, 100% na huban na natawagan yung mga nakasabay nila sa aeroplano?
Hindi pa po, kasi ongoing pa rin yung ating contact tracing. Out of 331, meron na po tayong na-assess na 58, and yung pong number of contacts on currently home quarantine, 53. At number of symptomatic contacts, 5. So, we're currently admitted for isolation. 4 are admitted, but 1 unfortunately refused admission. So, this is something that we might want to look into the quarantine laws of the Philippines and see how we can further strengthen. There can be hopefully a legislative space to look into how we can strengthen the penal provisions of the quarantine law and ensure that those who refuse, they will be, I don't know what the term is, forcibly made to subject themselves to quarantine measures.
Secretary Duque, Filipino ho itong ayaw magpa-quarantine?
Hindi, I will have to look into that, Your Honor. I'm sure the EB, Epidemiology Bureau, has the more granular report on this. So yung iba naman hotel resorts, hospital, andito naman, pati public vehicle, other venues, 5, hotel resorts, 41, etc. So we can give you the report, ma'am.
Sige po. And then, nabanggit niyo ho kanina, di ba may namatay ho na isa?
Yes,
ano na ho yung status ng body nitong
the 38-year-old female Chinese...
the 44-year-old male who passed away. Ano ho bang protocol natin pag namatay at may coronavirus? Ito ho ba i-cremate or do we send the body back na buo? Paano ho ba yung protocol?
We are in coordination, or we have been in coordination with the Chinese embassy. And the guidance is for the body to be cremated. Unfortunately, the first groups that we were able to contact initially agreed, and this is within the community of the Chinese Chamber of Commerce, who initially said they would cremate and put the ash rather in the ash in the whatever crematory that they have, no? But unfortunately, they backed out. So now we're talking with a funeral parlor that has agreed to do that today. So I just have to get the latest the update on this, whether in fact this the body of this Chinese national has been cremated. So we'll give you the updates as well.
Wala ho din batas that can compel DOH na yung mga crematoriums kailangan i-cremate nila kasi ilang araw na din ho ito. At hanggang ngayon, hindi pa rin ho siya nakakremate.
The experts behind me are one in saying that he no longer will be infectious once dead. So
pag namatay ho, hindi na ho nagiging carrier?
Wala na ho. Hindi na ho magiging carrier. Pero naka-sealed kasi ito, naka-sealed body bag ito. So talagang kahit na may agam-agam, yung pong measures ensure that this is sealed. And therefore, the coronavirus will not be able to get out.
Pero kung gano'n nga, Secretary Duque, bakit ayaw nila i-cremate if it's no longer contagious?
Well, they have their own mindset. That's the problem with them. Sabi ko nga, pambihira naman, your fellow Chinese, no? Dapat pakita ninyo na susuportahan ninyo But I don't know. I need to get the full story behind. But it's very unfortunate to hear stories like this, because it is at this time when they should, in fact, express more sense of, patriotism for their fellow Chinese national. So I don't know. It could difficult to understand.
Sige, Secretary Duque. And then, ilan ho yung staff na dedicated for contact tracing? Ilang staff ho yung dedicated for contact tracing?
Can I just ask my EB director? Ang contact tracing po natin we have for the flights in Metro Manila, yung Cebu PAC and the PAL, dito po the whole of NCR Epidemiology Bureau, surveillance officers. Ngayon sa region naman, doon po sa mga pumunta sa mga hotels, pumunta sa mga tindahan, ay yung ating pong Region 7 Epidemiology Bureau surveillance officers.
Ilan ho?
Inaantay ko lang po. Para
Kasi,
lang,
Secretary, remember, this is just one case.
yes.
I guess, pag nagkaroon pa ng, well, hopefully, wala sanang, hindi na madagdagan yung bilang, pero kung madadagdagan, kailangan malaman natin kung if there's a need to augment yung staff, lalong-lalo na pagdating dito sa contact tracing.
Well, meron hong mga hakbang na isinasagawa na nakikipag-ugnayan sa DILG. Kasi po kanina na-report na meron pong mga binubuong mga task force ang DILG para matukoy ng mga barangay captains, kung sino-sino sa kanilang mga mamamayan ang dapat quarantine. But of course, we need to level up their competence in being able to identify. So, yung pong technical support na yan manggagaling po sa atin, NCR, as well as in the concerned region. But the number, I'll get back to you, ma'am.
Kasi katulad itong dalawang pasyente na to, it's been how many days already at hindi nyo pa nakokontak 100% yung nakasalumuha nitong dalawang pasyente na to. I mean, yung hotels and restaurants, understandable, mahirap yan. But yung eroplano, una-una, may ano yan, di ba? Meron namang listahan ng SEBPAC, tsaka may flight manifest. Di ba dapat, ngayon pa lang, for me, dapat, Secretary, 100% na alam na ng mga pasahero na yon na they've been exposed to the virus.
We have, as of now, 17 surveillance officers plus 50.
And this is 17 epidemiologists and about 40 disease surveillance officers.
Okay, so the information is that we have 17 epidemiologists constituting a team with 40 surveillance officers. So ito po ang ginagawa, nakikipag-ugnayan din sa kanilang counterparts sa mga pamahalaan lokal.
So siguro, Secretary, ano yung nagiging difficulties nyo in getting in touch? Siguro lalong-lalo na dito sa kasama nila sa aeroplano.
I am told that efforts are being made to increase the number of surveillance officers.
Secretary, siguro ito lang sa plane lang. Let's concentrate dito sa aeroplano. For example, yung flight nila from Hong Kong to Manila, I think SEBPAC yun, di ba? 100% na hubang na-contact itong mga kasama nila sa flight na yon.
I am told that the Cebu PAC and PAL have a system in place to get in touch.
Secretary, I'm asking, simple question lang. I just want to know kung na-contact nyo na ba lahat ng pasahero from Hong Kong to Manila na sumakay sa SEBPAC?
With yung flight manifesto, meron na.
We have the flight.
So how many percent?
We were not given the surgeons updated numbers, and then we were not given the numbers na so but the airline they offered to assist in contacting the persons involved.
I guess, Secretary, mukhang hindi pa. Kasi,
It looks like, yes, ma'am, I'll be the first one to admit it's not easy to do this. In fact,
you know, Secretary, kasi, you know, we are all here looking for a solution. Kaya I'm asking you, ano ho yung nagiging constraints kung bakit hindi nyo makontak itong mga nakasabay nila sa eroplano? Baka hindi yun na nga hanggang ngayon, hindi pa rin alam ng mga nakasakay doon sa eroplano, nakasama pala nila.
meron ho silang mga announcement na ginawa na, the flight number and the two airlines have already continuously shared this information so that those who actually were inside the planes would know that they have to follow the following
But
steps.
apparently, Secretary, hindi nyo pa naaabot lahat
Hindi pa nga ho. I will
So ano
not
ho yung
deny.
nagiging problema? Is it kulang ba tayo sa manpower?
That's one
Or
of them.
hindi niya talaga alam kung saan sila pupuntahan kasi yung contact information sheet kulang? So, kasi may katulad nga ho, ng sinasabi, may passenger manifest ho tayo. In fact, pag foreigner kayo, meron pa tayong finifill up na form na ito yung address mo in the Philippines. Kung foreigner ka, pag local ka naman, more or less, I'm sure may database naman ng BI kung saan nakatira itong mga pasahero na ito. Kasi Secretary, ilang araw na ho eh.
Yes, ma'am. Ang contacted 17% of a total of 331.
17%?
Yes. Airlines are not sharing. Ito baka pwede natin hong pagkaisahan ito. The airlines are not sharing contact details of the passengers. Okay? So, they're invoking confidentiality. So, ito po ang kailangan natin harapin.
Can we get the, from CAB or CAAP?
Yes, ma'am.
So, ibig sabihin, Secretary, hanggang ngayon wala pang may kopya ng flight manifest?
Meron
Kasi ayaw ibigay ng airline?
Meron but no contact details. Redacted.
Sige po, GF.
No, that's why we can discuss it here for legislative.
You mean to say foreigners enter?
Thank you, Mr. Chairman, Your Honors. In my experience, the airlines would readily give this kind of information, especially under special circumstances like we have today. So in my experience, the experience of our office, they would be willing to share it, especially during an event like this.
I guess, let's go back to the basic. Ano ho ba naging protocol natin? Who asked the airlines to provide them the manifest with contact details?
We do. The Epidemiology Bureau of the DOH was instructed very clearly to get the flight manifesto. And from there on, I thought that things would be as usual, that there shouldn't be any problems. But now, I'm being very strange. They're saying that the airlines are the ones contacting the passengers and informing them. And that we're not given the number. But all of these will be subject to validation, Your Honor, so that we will know exactly how to address this issue. It is a very serious issue.
Yes, Secretary. At,
Yes.
you know, mas nakakalungkot, parang hindi kayo nag-uusap.
No.
Diba? I mean, di sana, Secretary, kayo could have coordinated with CAAP or CAB na may ganito kayong difficulties na hinaharap ngayon. Because, di ba nga, katulad na sinabi nyo, napakahalaga netong contact tracing. But apparently, kulang na kulang tayo. With the permission of...
With the permission, Mr. Chairman, with the permission of
go ahead,
and our other colleagues.
Senator
Simple lang
Lacson.
po, wag na po yung airline, DOH to airline, wag na po yun, sabi nyo, hindi nagko-cooperate. DOH to DOTR or directly to CAB. Hindi ba pwedeng mag-usap and then they can order the airline to produce the manifest? Yun lang po.
Go ahead, Senator De La Rosa. You may interject.
Yes, with the permission of Senator Binay. Sir, Secretary Duque, once you have the manifest already, bigay nyo sa PNP. 3 days lang yan, maximum 2 days. Accounted lahat yung tao na yan. How ninyo soluhin ang problema? Hindi ninyo sinishare sa ibang ahensya eh. Sabi nyo, competency. Turuan yung police anong gawin para hindi mag-spread yung virus. Di ba, 2 days lang yan, accounted lahat ng tao na yan. Pag ibigay nyo listahan sa police.
Your Honor, Mr. Chairman, I'm told that these airlines are invoking the Data Privacy Act. I don't know how. This is rather strange. In the time of urgent, situation, I do not understand why this is the case, but I think that has to be investigated, and we will look into it, Mr. Chairman, why this invocation, which I find very inappropriate, to say the least.
Okay, go ahead,
Sir.
GM Monreal.
Sir, with the permission of the chair and the rest of the members, allow me to outline, as a former airline employee, again, for 30 plus years, there are protocols. First of all, when a passenger makes a booking, the airline, before closing the reservation, they give the details. Even to the US, the addresses of the passengers are being taken down. Okay. Now we're talking about this situation. Right now, the situation is in contact tracing. As soon as the name of the passenger is relayed to the airline, I can attest to you that they will not withhold the name. Based on the protocols, the revised protocols now, with a person involved, in, if I say that the suspected person, based on ICAO standards, the 4 rows in front, 4 rows on the right, 4 rows on the left, and 4 rows at the back. 4 seats, seats or rows, to make it more. Then those are the primary suspect or to be contacted. You don't have to call all the passengers because as a commercial carrier, they are equipped with HEPA filters. HEPA filters normally, clean the air inside the aircraft. But however, that being said, we have already been in the news that there's a contact tracing. People, as long as you tell them the flight number, the exact flight number, I'm sure if you were that on board, you will initially also volunteer yourself. So basically, I don't see any reason why airlines are going to withhold the name of the passenger.
Go ahead, Secretary Locsin.
What I know is that not just as Secretary of Foreign Affairs, but as any air traveler, is that you cannot even get out of the plane unless you give the details that says, where are you living, what is your address. I have been reprimanded in airports for failing to give the exact address of the hotel. Therefore, that slip of paper is in the custody of the Bureau of Immigration, and there is no such thing as a right to privacy. Otherwise, we are open to foreign invasion.
Mr. Chairman.
We would like to request the DOH to coordinate with the CAAP, the Bureau of Immigration, the PNP, to aid in tracing of contacts like during the MERS-CoV incident in 2013. So pwede nyo pong pag-usapan yan sa inyong interagency task force, Secretary Duque.
Mr. Chairman, just
yeah.
one point, Mr. Chairman, with the indulgence of our distinguished
Go ahead,
colleague.
Secretary.
I think it's
Senator.
important to find out who is in charge, Mr. Chairman, from DOH, who is in charge of this tracer contract tracing, Mr. Chair. Kasi I think lahat tayo, overwhelming yung consensus ng buong Senado na unacceptable po yung at this point in time, we are only talking about the passengers on the plane, 17%. 17%. We wanted to find out who's in charge, who's accountable. Kasi kung sasabihin natin, ready tayo, we're doing everything we can, and then we hear from the horse's mouth na hindi sila na-contact, hindi sila na-coordinate kung paano sila makakatulong. We just wanted to know, Mr. Chair. Thank you.
Mr. Chairman, this is quite operational, and I have been in touch with our epidemiology bureau. In fact, for the record, I would like to state his name. His name is Director Ferchito Avellino. And in all of our meetings, there has been no indication or no issues raised to me that this is a problem. Because he's saying, he's telling me that he has already spoken to my undersecretary, but I'm not aware that this is this very operational. As a Secretary of Health, I really don't know the steps, the specific measures of how this should be done. And I hope, Mr. Chairman, that you give me a chance to look into this, and I'll have it investigated, because I can see here an issue of lack of transparency on the part of some of my people here. And I'd like to investigate this to go into, because alam niyo, nangyayari po lahat ito. Araw-araw, ini-interview kami, araw-araw, nagmi-meeting, may task force, may repatriation. Yung po mga ganitong operational details, hindi po nalalaman ng Secretary of Health yan. And I think some of the secretaries would agree with me that such operational details are already assumed as part of their job, and we presume this is part of the regularity of their work. So, mahirap naman po yung secretary na pakikialaman ko lahat ng detalya, and I will lose sight of the bigger picture, the more strategic interventions.
Mr. Chairman.
But I will have this investigated, Mr. Chairman.
Go ahead, Secretary. Everybody.
Mr. Chair, sad to say, what we have here is a glaring example of a failure to communicate. The Senate committee is now asking for what should be the protocol or what should be the template for the process. You know, if the Department of Health will be the one that will follow up the airlines, and the Department of Health has no ascendancy nor power to put suspension or to force compliance, they'll not follow. The protocol should be, once there is contact tracing, CAAP and CAB should take it upon themselves to commence and trigger the contact tracing, because they have the power and the ascendancy over the airlines. Hindi ho ba kung magpa-follow up tayo, ang magpa-follow up yung may poder at may authority para sumunod? Kung ang magpa-follow up ho, walang poder at walang authority, Panginoon ko, hindi ho susunod yan at magdedelayan. So that to answer this statement of the Senate committee, what is the protocol? The protocol, we must agree now that all contact tracing following up the airlines must come with the position on CAAP or CAB. Ganun ho yun. Mas magandang mag-follow up yung may hawak ng latigo. Kasi kung ang magpapalaw up ho, walang hawak ng latigo, uulitin ko, Panginoon, that will be delayed, baka hindi pa sumunod yan. Yun talaga yun. We have here a sad situation of a failure to coordinate. That is sad.
Chairman, very quickly, with the permission of Senator Binay. And the
Go ahead, Senator.
Very quickly, Mr. President, Mr. Chairman, I beg to disagree that the Secretary of Health is pointing his finger at his underlings, when there is only 17% of those passengers have been contacted since this issue erupted. I think it's not just a failure of, failure of communication. I think it is also a failure of leadership on the part of the health department. I'm sorry if I have to put that on record, Mr. President.
Chair?
Go ahead,
I
Senator
think
Binay.
tapos na ho ata yung 5 minutes ko. I only have one last question. Secretary Duque, I've heard you several times na medyo nagkakaproblema tayo kasi may language barrier dun sa mga PUIs. Tama po ba?
That's right, Your Honor.
Have you hired the Chinese interpreter na magpo-full-time?
So the agreement that a interpreter should be hired for better communication.
So at the moment, wala pa rin ho tayong Chinese interpreter.
Requested the DFA, for a dedicated group of translators. Dumating na? So we'll follow up on this, Your
So wala
Honor.
pa din ho.
Oha.
Wala pa rin ho tayong pool of translators. Secretary Locsin, baka pwedeng bigyan niyo ho sila ng pool of translators.
Ma'am, if I may say, this has nothing to do with interpreters. Nobody can enter this country without filling out that form. That form is in the custody of the Bureau of Immigration,
No.
and it should have been accessible to you guys.
No, Secretary Locsin, because I've heard Secretary Duque say, yung first patient na coronavirus, medyo may language barrier daw
Yes.
when you're interviewing her because Chinese nga siya. So I think dapat may dedicated team din ngayon sa DOH na Chinese speaking para if there's more Chinese patients that will come in, hindi mo magiging problema to communicate with them. And I think siguro kailangan din may complan tayo, I don't know, parang Chinese complan. Kasi alam naman ho natin, at the moment, marami ho tayong Chinese workers, Chinese tourists, and baka hindi ho nakaka-reach sa kanila yung message on how to address this virus.
Yes, ma'am, but I won't throw blame all over the place except at CAB and the Bureau of Immigration. Aside from those two characters, let me just say that the Chinese language experts are deployed in China. Anything else, I think it behooves us to go to the Chinese schools and recruit them if they will join us. But yes, you're right. Also, for the tourists who are coming in, I think a program should be started to enroll the Chinese school teachers to join, and perhaps we can pay them. But meanwhile, these two characters here should do their jobs. As I was just telling them, when it's time to throw people under the bus, please, the bus is there.
Thank you, Mr. Chair.
Senator Binay, I was informed that the DOTR Secretary Tugade, Secretary Dominguez of Finance, and NEDA Secretary Pernia have to leave for another important meeting. The heads of the attached agencies of DOTR will remain here. Any senator would like to ask quick questions to the DOTR, DOF, and NEDA? If none, we wish to thank them for giving time and attending this hearing. Go ahead, Senator Moily.
May we just appeal to the other CABSECs who are going to leave that can we get the problem of communication addressed so that we can, at least when you leave, we are given the assurance that the matter will be addressed.
The issue was aptly and properly propounded here. The issue being, what is the protocol? Apparently, there is no established protocol, Your Honor. And what I'm saying now is, let it be that the established protocol is when it comes to contact tracing, it should be CAAP that will get in touch with the passengers. Bakit ho CAAP? Kasi ho, hawak nila yung latigo eh. Pag hindi sumunod yan, latiguhin mo yan. And then bigyan mo ng time frame yan. Hindi mo naman ibibigay sa kanila yung option to decide when to give the information. You say,
Mr.
in
Chairman,
24 hours, in
very
12
quickly,
hours,
as a retort.
submit or else.
As a retort, Mr. Chairman.
Senator Lacson.
Now, what happens to the principle of the unit of command? I thought this is a health issue, and the DOH should be the first line of defense, and should be designated as the OPR, the Office of Primary Responsibility. We shouldn't be blaming other people, because this is a health issue. And it's wrong to point to BI and CAAP. It should be the initiative of the DOH. And what we have here, as Senator Pangilinan mentioned earlier, is a failure of leadership.
If I may I just simply say that it was the instinct of the Department of Foreign Affairs when a health issue came up, we immediately surrendered authority to them. That should have been surrendered by the
That's
two
exactly my
characters
point.
I have mentioned.
That's exactly my point. The DOH should be in charge on top of the situation, not the CAAP, not the BI, not the DOTR, but the DOH.
Mr. Chairman,
Senator Bato, you may interject.
Well, I subscribe to what Secretary Tugadi said, na kailangan ng latigo. But at this point, I would like to request the chairman to please pasalitain natin ito taga PAL because without, sabi nga nila, without the latigo, PAL mismo nagsurrender kagad ng listahan ng manifest doon sa taga Bureau of Quarantine. Anong ginawa ng Bureau of Quarantine ito? Itong manifest na ito?
Senator Bato, we have a representative from PAL, Cesar Ordoyo. May we hear from you, Mr. Ordoyo?
Good afternoon, Mr. Chair. I'm John Ordoyo of the VP of Security for Philippine Airlines. Good afternoon, everyone. I'd just like to correct the impression of the good secretary regarding the cooperation that they're getting from the airlines. As a matter of fact, in tandem with Cebu Pacific, we already communicated to the Bureau of Epidemiology our concerns regarding the proactiveness of the contact tracing that is being done. As a matter of fact, we have given them the list as required because as per protocol, it would be the BOQ who should be following this up. But we waited until such time our President and CEO, Mr. Santa Maria, gave us the go signal to initiate, if possible, the airline could support. And we did that. We already submitted the names of the passengers as seated adjacent or in close proximity to the suspected or infected passenger. And as a matter of fact, just to alleviate the fears of this august body, as of the moment, we were able to contact a total of 74 as advised out of the 132. So meaning it's about 21 of the 31 passengers who are closely seated, the two passengers, were already advised. And we were given the impression that they have reached out already to the passengers. So they told us, two of them contacted DOH. And this is coming from the Office of Epidemiology. So at this point, Your Honor, Mr. Chairman, I think the airline is in full support and cooperating and proactively doing this because we know the effect and, of course, the risk involved in here. So we are cooperating.
Go ahead, Senator Riza.
Salamat, Mr. Chair. Sa current flow ng hearing natin, may mga 5 punto na akong nakitang lumabas. Una, palakasin yung community health surveillance. Pangalawa, yung voluntary o mandatory reporting nung mga galing sa China. Pangatlo, functional na epidemiology and surveillance unit per LGU. Na yun, Mr. Chairman, ayon sa RA 11332 or yung Mandatory Reporting of Notifiable Disease Act. Pang-apat, with all due respect, mukhang hindi kaya ng isang task force lang pag ganitong public health emergency kasi nga may kinalaman sa leadership and governance. At meron po akong proposal tungkol dyan mamaya, Mr. Chairman. And last but not the least, sa ngayon, in the spirit of fairness, kailan ba hiningi sa mga airlines at nakapagsalita na rin yung taga-PAL, kailan ba hiningi yung passenger details? Ilang araw bago nagsabi sa airline when they had confirmed the cases. Pero para umabot tayo dun sa 5 puntong iyon, let me backtrack a bit, step backward a bit, Mr. Chair. Gusto kong balikan kung papaano tayo nagkaroon ng first confirmed case of nCoV in the country. So, may please confirm these details with the DOH. So, una po, she is a 38-year-old Chinese woman who traveled from Wuhan to Hong Kong on January 20 and arrived in Cebu on the 21st. Is this correct, Mr. Chair?
In fact, we have a slide to show.
Thank you,
The,
Mr. Chair.
timelines.
Yes, Mr. Chair.
Can we just
I'll
have
just
it-
continue. It's all right, Secretary. Gusto ko lang pong establish yung timeline para maka-move forward tayo sa ano yung kailangan nating gawin. Pangalawa, so is it also correct to say that she was asymptomatic at that time? Ibig sabihin, walang sintomas, walang ubo, walang sipon, walang lagnat.
Tama po kayo.
Thank you,
Based on
Mr.
our
Chair.
timeline.
Is it also correct that she traveled pa from Cebu to Dumaguete on the 22nd January, Mr. Chair?
Tama po kayo.
And is it also correct that she spent 3 days in Dumaguete before flying to Manila on the 25th?
Yes, tama po kayo.
And then, January 30, 9 days after niya lumapag sa Pilipinas, she became the first confirmed case of nCoV in the Philippines. And is it also correct that she, at ito, Mr. Chair, sobra kong na-appreciate sa babaeng ito, is it also correct that she voluntarily went to the hospital to have herself checked? At yun ang dahilan kung bakit siya na-confirm. Tama po ba?
Yes, ma'am.
Alright, Mr. Chair. Ngayon, ang China-wide travel ban ay nitong linggo, February 2. Ang worry ko lang dito, Mr. Chair, ay marami-rami na ring kaso na mga kagaya ng ating first confirmed case. Possibly. Pwedeng mamasyal pa kung saan-saan, dumadami ang contact points. Mr. Chair, alam ba natin kung ilan na ang nakapasok sa bansa mula nung nag-lockdown ang Wuhan noong January 23 at bago ang ating travel ban? Nakakapag-report ba sila sa ating health authorities? Alam na natin kung ilan at sino sa kanila ay may sintomas at nasa na sila sa bansa ngayon. Namomonitor po ba natin sila, Mr. Chair?
Yes, Your Honor. Meron po ako ritong datos na pagdating dun sa hotels, resorts, hospital, public vehicle, other venues, maganda yung performance eh. For example, the number of contacts on home quarantine, 36/41. Sa hospital, 5/5. Sa public vehicle, 1/1. Sa other venues, 4/5. Ang katakataka lang po rito talaga yung sa flights. Kaya nga, I want to, in fact, let me just, for the
Mr.
record...
Secretary, I'm sorry to interrupt at this point, but I think the point has been clearly and correctly made na kailangan, and DOH has all the mandate as the commander under this unity of command that Sec. Locsin said, to acquire that data in the interest of public health. But please do submit yung mga data na sinabi nyo earlier sa committee through the chair. Pero what if, Mr. Secretary, in the case na kapag yung isa sa mga traveler na ito ay magkasintomas nga pero ayaw mag-report, ano po ang gagawin, paano sila ima-manage?
Okay, like the one in the Iloilo event, the EB called the embassy and in coordination with the PNP.
Thank you, Mr. Chair. At least nakikita yung interagency cooperation to respond to problematic situations like that. Paano naman kung may isang Pinoy, nagkaroon ng contact, nagkaroon ng sintomas, pero dahil Pinoy tayo, di ba, takot tayo sa ospital, minsan sa gastos, kung simpleng ubo, di naman tayo automatic na nagpapa-check up. Handa po ba ang DOH sa ganitong scenario, Mr. Chair?
Handa po. At saka yung pong kanilang agam-agam na baka hindi sila makabayad, meron na po tayong ginawa sa PhilHealth nCoV package, which is 14,000 per member who is admitted for nCoV illness. So, ito nga lang po, Mr. Chairman, with your permission, I just want to put on record that itong mga ito, ako na nga po ang nagmando sa akin pong mga tao. Now, you have to give me the names of all the people that these patients had interacted with. It was me. You ask these guys. And kaya nga, I'm really worried because there's an institutional competency problem here. Because
And
when
we
you're
will
the
get to
Secretary
that,
of Health,
Mr. Chair.
and then you start looking into such granular, and in fact, I did it. You can ask these guys. I've been telling them, you give me the target. You have to identify. There has to be a metric. You have to show me the number of people that these patients had interacted with. There has to be some kind of a projection of numbers.
Yes,
Ganito
Mr.
po,
Chair.
sinabi po
And
sa
I
akin
believe,
yung 4 by 4 by 4.
yes, Mr.
Yung
Chair, I
4
believe
sa
as
harap,
we
4 sa likod, 4 sa kaliwa, 4 sa kanan. So sabi ko, o di gawin ninyo. And ito naman, yung akin, with all due respect, sinabihan ako na baka daw naglakad naman yung pasyente throughout the fuselage of the plane. So pwedeng umubo, pwedeng may nahawakan. So go ahead. Sabi ko, if that's what you think, then go ahead. That's your job. That's your competency. You don't expect the Secretary of Health to know the operational detail of contact tracing. I know
Mr.
the
Secretary,
importance of
there
contact tracing.
is one thing that the Secretary, as the chair of PhilHealth, could know. So gusto ko pong i-put on record ito sa ating komite for further discussion. Nung panahon po ng outbreak ng SARS 2003, ang PhilHealth package po noon ay may halagang 50,000 pesos. Pero sabi nyo po, para sa nCoV 2019, 14,000 pesos lang. So baka that is also something for our committee to look into further. In any case po, Mr. Chair, no, nakakabahala po yung iba't ibang ganitong mga sitwasyon at scenario. I also want to put it on record that I am grateful for the hard work of our Department of Health. I'm sure hindi pa kayo nakakatulog, on-call po kayo 24/7, and the public would be grateful for a stringent community health surveillance to be put in place right now. Right now, Mr. Chair. Alamin natin kung ilan at nasaan. No excuses on the part of any of us. Ilan at nasaan na itong mga nakapasok bago pa ang lockdown at travel ban, lalo na yung mga galing sa China in the past 2 to 3 weeks, magkaroon ng voluntary or mandatory reporting, i-monitor ang kanilang kalagayan at bigyan sila ng angkop at sapat na healthcare interventions. May mga nagsasabi na huwag mag-panic, Mr. Chair. Tama naman iyon. Pero hindi mo rin po masisisi yung ilan nating kababayan kasi hindi pa naman ka-level ng Japan ang ating healthcare system. So I really believe we really need to do all of these necessary precautions. And kaugnay nito, Mr. Chair, sa ilalim nga po niyang RA 1133-2 o Mandatory Reporting of Notifiable Disease, may dapat pong nakatalagang epidemiology and surveillance unit sa bawat LGU, sa bawat health facility, sa bawat points of entry. So, ilang ESU po ang naitayo, Secretary, simula nang maipasa yung batas? Ilan po ang target pa na maitayo at ilan po dito ang functional?
The 17 regions have the epidemiology surveillance units, which are all functional.
Below the regions, Mr. Chair, meron din po bang LGU sa lower level, closer to the ground, closer to the people, na mga LGUs po natin?
I'm told there are about not more than 10, Your Honor.
So siguro, Mr. Chair, that's also something for us to look into, na makapacitate, masuportahan yung ating lahat ng mga LGUs, lalo na po yung mga low-income LGUs. Yung health facilities po natin at yung points of entry po natin, meron po ba silang mga epidemiology and surveillance units?
Meron po tayong designated lang na mga epidemiology surveillance officers. It's a plantilla issue that we hope to be able to make the representation with the DBM to allow us to create additional plantilla positions.
Well, nabanggit na rin po kanina, Mr. Chair, yung possibility which I think everyone around the table ay susuporta ng supplemental budget kaugnay nitong 2019 nCoV. Pero yung RA 1133-2 ay naipasa po nung nakaraang kongreso pa. So dapat naging proactive tayo, siguruhin na lahat ng dapat tinayuan ng ESU ay naitayo na bago pa nagsimula yung ganitong public health emergency ulit. At lahat po ba, at least ng mga established ESU natin, yung sa 17 regions, yung 10 others sa lower levels, kung saan po nakadeploy yung ating mga designated officers, ESU officers, lahat po ba niyang mga ESU ay may kakayahan at handang tumugon kung sakaling magkaroon ng local outbreaks?
Our regional ESUs have the capacity because they've in fact underwent massive training for 2 years in terms of leveling up their competencies, Your Honor.
And what about, Secretary, yung 10 lower level ESUs? At yung mga ESU ba or kung saang opisina nakadeploy yung ating ESU designated officers?
Well, what they have been provided is a basic training on field epidemiology. However, these are all supervised by the regions, and the gaps are being assessed every now and then to be able to address those gaps, Your Honor.
Well, bilisan po natin, Mr. Chair. Hindi na panahon para mag-assess lang. Kailangan kayo po talaga yung front line of defense natin sa anumang public health emergency. And paalala ko lamang po na under that law, all LGUs may ESU dapat. All LGUs. Mungkahi ko po, Mr. Chair, na i-audit ang kasalukuyang bilang niyang mga ESU at siguraduhing functional ang mga ito sa susunod na mga araw at linggo, lalo na sa mga lugar na pinaglalagian ng mga bisitang nanggaling at dumaan sa China, anuman ang nationality nila, at sa mga lugar na mayroon ng confirmed cases of nCoV. Kaugnay po nito, Mr. Chair, gusto kong malaman mula sa DILG kung naihanda ba nito kay Nasec Anyo, policy guidelines, programs, plans, ang ating mga LGU, yung kanilang mga responsibilidad sa ilalim nitong RA 11332. At may baseline po ba ang DILG at ang DOH kung anong capacities ang kailangan pa ng ating mga LGUs in relation sa 11332, Mr. Chair? Kaanyo, please.
Yes, ma'am. We will work that out with the DOH and comply with those requirements, Mr. Chair.
Ang tanong ko po, Mr. Chair, ay kung naihanda na ba yung ating mga LGUs para sa kanilang mga responsibilidad sa ilalim ng RA 11332?
Yes, Mr. Chair. We've been doing, even in our newly elected orientation, kasama po yan sa aming mga dinidiscuss with our LGUs.
Siguro po, Mr. Chair, pahingi na lang po ng in writing yung update po ng DILG for the appreciation ng komite para mas epektibo pa kaming makasuporta doon sa mga LGUs natin na in partnership sa DOH, ang frontline of defense talaga, lalo na laban sa anumang posibleng local outbreaks. At Mr. Chair, nabanggit nga po, yes, Mr. Chair.
Secretary Lorenzana wishes to be excused, but before that, moving forward, a few questions for Secretary Lorenzana, Secretary Bello, and to the DFA. What are your plans for our OFWs in the affected areas? Papauwiin ba natin sila? Pinayagan na ba sila? How about the Filipinos who are coming? Together with the DFA, what are the preparations in place for this? Is our quarantine facility in Fort Magsaysay ready as directed by the President to Secretary Lorenzana? Handa ba yung ating pasilidad sa Fort Magsaysay?
Mr. Chair, yes, it's always ready there. About half of that is not being used anyway, so we can make that available for the quarantine purposes of our OFWs.
Ano pong capacity nito,
The whole facility, Mr. Chair, is capable of accommodating 10,000 patients.
Malaki. So, to Secretary Duque, yung RITM natin does have the capacity to handle the laboratory testing of a growing number of persons under investigation and also to manage these confirmed cases, if ever. And how long is the procedure? During the budget deliberation, we have increased the budget of RITM for 2020 to further capacitate the RITM from the proposed 118 million to we have increased it 223 million. Gaano katagal po itong testing? Makukuha ba kaagad yung resulta para magkaroon kaagad ng peace of mind ang ating mga kababayan.
Your Honor, Mr. Chairman, the RITM has just gotten the RNA primers needed to test for the novel coronavirus from Japan. And these arrived Wednesday last week, and they had to run the test, they had to prime the test, and on Friday they were able to actually do the test for the novel coronavirus. So it takes about 24 to 48 hours before the results are out. But having said that, we understand that the capacity of the RITM is now to the max. And we have, in fact, agreed yesterday that the RITM has to quickly assess the laboratory capacities of the private sector facilities, the hospitals, laboratory diagnostics, and they will be supporting them so that the private hospitals will, on their own, be able to quickly test for the novel coronavirus. So this is now in place. The WHO has already provided the primers for not just RITM, but also for capacity building for the private sector hospitals. So yan po, yung isa pong primer, ito po 1,500 ang kayang gawing test. And I was told by RITM, there are already two sets of RNA primers. So makakapaggawa na po sila ng 3,000 tests. Ang problema lang po, dahil ang test results come out from 24 to 48 hours, talagang hahaba ka po yung linya sa RITM. Kaya dapat we have to have simultaneous testing capability, and that's where the private sector has come in, Your Honor.
Secretary Lorenzana wishes to be excused if there are no questions to the DND and also to the Chief of Staff. Laging handa naman itong mga sundalo natin para tumugon kaagad sa pangangailangan ng ating mga kababayan. We thank Secretary Lorenzana and General Filimon Santos for attending this meeting, sir.
Thank you, Mr. Chairman.
Go ahead, Senator Riza.
Thank you. Thank you, Mr. Chair.
This is your last question.
All right, Mr. Chair. My last question for my first round kasi meron pa akong ibang mga tanong. Kaugnay po nung ating mga OFs. Nung nakaraang linggo, nanawagan ako ng full assistance para sa ating mga OFWs na mga kailangan ng tulong sa kanilang repatriation kung kinakailangan. So dagdag po dun sa sinabi na ni Sec Lorenzana, maaari bang magbigay ng update ang ating DFA kung ano na ang plano at aasahan mula sa mga magbabalik bansa mula sa mga lugar na apektado ng nCoV outbreak? Ano ang ginagawang paghahanda para dito, lalo na sa kanilang reintegration sa kanilang mga pamilya at komunidad, Mr. Secretary, Mr. Chair? Secretary Locsin, update on plans at yung maaasahan ng mga maaaring ma-repatriate ng mga kababayan natin, paghahanda, and then lalo na for their reintegration into their families and communities.
I don't know about the reintegration, but I do know that we have now coming in from Hubei province. I immediately turned to the boss of this whole operation, who is now overburdened. What do we do? And he said there are protocols for that. They will be stopped at the airport. They're arriving in Clark, and then they will be taken to quarantine facilities. Now, the question is, what about those, and I raised this yesterday, what about the Filipinos who came, for example, from Hong Kong, and their employers want them to go back because the domestic helpers in Hong Kong are well treated. They are not treated savagely as they are in other countries. In Hong Kong, they are cherished. And Carrie Lam, the executive of Hong Kong, has asked, please, can they come back? And the debate yesterday. question is, isn't it a duty on our part to protect them? This came up already in the question of our workers in Tripoli. The workers in Tripoli said, can we go home for Christmas? And some departments said, well, if they do, we will stop them from going back to their jobs in Tripoli because there is danger there. My argument was this: if we don't let them come home for Christmas, they stay in Tripoli, they will be killed in Tripoli. But if you follow me and you let them come home for Christmas and let them go back to their jobs, supposing something happens to them, well, they will die happily because they spent Christmas with their family. Now, that may sound like a joke, but I don't joke with the lives and the feelings of my people abroad. It is easy to talk about my people from here, but I care for them, not just for their safety, but for their feelings. That is the policy of the Department of Foreign Affairs.
Thank you, Mr. Chair. So siguro in my second round, kung may second round tayo ngayong hapon, pwede natin i-follow up yung other areas of reintegration at saka ito ngang issue ng security ng trabaho ng ating mga OFs. So kailangan linawin sa DOLE at POEAE anong advice nila tungkol dito. Basta overall, Mr. Chair, bigyan po natin ng full assistance ang ating mga OFWs na nais maghanap buhay at kasabay siguraduhin natin yung kanilang kaligtasan at kalusugan saan man sila naroon. So that's it from my first round, Mr. Chair. Thank you, Mr. Chair.
The tourism impact was already presented earlier by the DOF. If there are no other questions for the DOT, Secretary Puyat is excused. We thank Secretary Puyat for attending this meeting. You have one question?
For Secretary Puyat. Perhaps I can also direct this to Dr. Rahindra. You mentioned a while ago, and I've been reading the WHO reports, that coming from the WHO spokesperson himself, Dr. Christian Lendmeyer, that there is supposed to be no travel ban. Are you reiterating this? Because I've been glancing at IHR rulings that there has got to be one voice. No offense to Secretary Locsin, IHR here is not human rights, international health regulations. So, ano po, you're a foreigner, I'm a little bit confused. You are recommending a no travel ban, while some sovereign states are imposing a travel ban. So which is which? Which should supersede? Because everything emanates from your directives as the World Health Organization, and that probably would be the concern of the Secretary of Tourism. Is a travel ban needed right now, or do you leave it to the sovereign states to decide whether to impose such a ban? Doctor, a short answer.
With your respect, sir, the WHO recommendation is a global recommendation. As I mentioned earlier, it depends on the travel pattern, meaning your proximity and exchange number of people, and also your healthcare facilities, basically the risk you perceive that this outbreak in China poses to your country. So our recommendation, being a global recommendation, is that to minimize social and economic disruption, we do not see a point in restrictive travel bans. But this is just a recommendation. We have left it up to member states based on their assessment of the risk they face and the capacity of their health systems to make their own assessments. This is a sovereign judgment.
It's just a recommendation, and
yes.
While we are having a hearing here, we were just informed that a third victim died in Hong Kong, and a cruise ship is now being held in Yokohama, containing 3,700 tourists being quarantined right now. So, in effect, you're leaving it to the sovereign states to decide whether to impose a ban or not.
Yes.
So, Secretary Berna, I think the tourism industry is you have a friend coming from the WHO. Tourism will still flourish, not just for domestic tourists, but even for foreign travelers. Is that the impression?
So, to clarify, sir, our experience based on previous restrictions have shown that these are not 100% foolproof. But we also recognize that China has imposed its own travel bans, including a lockdown of Wuhan and other cities in Hubei province, and also enforced a travel ban for tour groups of Chinese citizens leaving China. So they are also discouraging unnecessary travel of Chinese outside of China, and they are also enforcing exit screening at international airports. This is also their effort to minimize international spread.
Thank you, sir. Thank you, sir. Mr. Chairman, we can dispense with the presence of Secretary Berna.
Thank you, Secretary Perna, for attending this meeting. Your excuse. Next is Senator, it's your turn.
The permission of my colleagues to continue with my questioning addressed to Secretary Duque. Secretary Duque, you're not under investigation here. I'd like to congratulate you for your initiatives. I just have some questions relative to your Resolution 01, dated 28 January 2020. This is something to do with the Interagency Task Force. Probably, just as a policy recommendation, why don't we include the Secretary of DepEd, Secretary Briones, considering that we have 27.2 million students in public schools and private schools right now. So kailangan din po sigurong matulungan yan, Secretary Duque. And then, again, I think you are well suited for this position because as former chairman of the Civil Service Commission, we have more than 1.7 million employees. I think you can have your appropriate inputs relative to the operations of this interagency task force that was organized. But one important question before I finish this, Mr. Chair. Sabi ni Secretary Duque kanina, hindi ko nababanggitin tong Cebu Pacific Flight 5J241 Hong Kong Cebu, DG6519 Cebu Dumaguete, hindi ko na po babanggitin yon. Hindi ko kayo tatanungin doon. Sabi niyo po kanina, you received an X amount last night coming from the President himself, 2.25 billion, and I heard that the bulk of this will be used to purchase chemical suits for persons who will be the first responders or the frontliners. Tama po ba yun, Dr. Duque?
Tama po. Ang tawag po doon yung HAZMAT, the hazardous materials, which constitutes the personal protective equipment, as I have enumerated, yung goggles, yung gloves, yung N95 mask, the gowns, the aprons. So, kompleto po ito at 1,500%.
Siguro po, Secretary Duque, with that amount, and having heard your statement a while ago that you acquired from Japan 2 sets of primers. These are the testing kits. So nakakapagtaka siguro bakit 2 sets lang yung nabili. If this will be a full-blown epidemic, baka kulang po yung 2 sets. Sabi nyo, pipila, 24 hours ang resulta bago lumabas. I think 2 sets would not be enough. I think you should have sets in Mindanao, Visayas, the National Capital Region, and even Clark Air Base. So, hindi ba pwede yung dagdagan yun?
Yes, sir. Hindi po ito mga test kits. Ito po yung RNA primer.
So, what's the difference between a primer and a test kit?
Ang test kit ito yung mga rapid diagnostic test, which we still don't have, by the way, available in the market. Wala. Ito ang ginagamit natin is a chemical na pinadala po sa atin, RNA primer, so that it's like a code that more or less it will guide you to identify. This is exactly the virus that's similar to the one in Wuhan.
So kaya po nagtatagal, Dr. Duque, ang RITM kasi wala tayong test kit. Am I correct?
Wala pa ho kasi. It's not available.
No. The WHO can correct me. I heard that that Thailand, there was a recovery in Thailand, a 71-year-old male recovered a while ago. But going to the test kits, no, with due respect to Secretary Duque, it was just announced that Jiangsu province in China has developed a test kit for nCoV that works in under 15 minutes. And the latest report is that the detection kit can detect the virus within 8 to 15 minutes and has a high sensitivity and is easy to use and transport. And it is now being mass produced at 4,000 kits per day. Siguro we can get hold of that. We have an ambassador in China, some consul generals in several parts of China. So sila naman nag-invento nitong sakit na to. Baka makabili tayo dito sa Jiangsu province, 4,000 kits with the budget given to you by the president last night. Just a policy recommendation, Dr. Duque.
So we welcome the policy recommendation, but the rapid diagnostic test has to undergo assessment by the experts, and I defer to the World Health Organization to guide us, because we cannot just be getting the RDTs from different sources without vetting
I
them.
understand, but since you have been touching base with Japan, providing with you the primers, Japan has also developed a test kit. So bakit hindi po tayo humingi na rin din sa Japan to abbreviate all of this? Because even if you have the necessary budget for the chemical suits, what is important is to detect at the ground level kung sino ba talaga ang mayroong carrier o wala, sino may virus o wala. But without the test kit, I don't think we can proceed at a faster pace, Mr. Secretary.
Senator Tolentino, if I may clarify, WHO is working with several research groups, both inside China and outside China, to perfect rapid diagnostic test kit, which will not require molecular equipment to do PCR assays and which can be used as a point of care diagnostics. Internal assessments are, the assessments of the test kits will not be completed for about another week to 10 days, after which we have agreed that we will provide test kits to Philippines and other member states at risk. So we are also working on the research agenda so that we can broad base the facility for diagnosis, because the bottleneck for diagnosis currently faced in the Philippines is not unique to the Philippines. It's a similar concern that many countries have, and that's why WHO is working with many research institutions to fast-track the rapid diagnostic test kits. And we are hopeful that we'll have that hopefully within 7 to 10 days.
Thank you, Dr. Rapintra. Maraming salamat, Secretary Duque, and good luck. Alam kong gagawin mo yung dapat gawin dito. Thank you, Mr. Chairman.
Go ahead, Senator Kiko.
I believe they have from the national, yes, in relation to what Senator Francis Tolentino. Yeah, please go ahead and make the manifestation.
Your Honor, we would like to state that the University of the Philippines National Institutes of Health, we're already in the process of developing a kit which should be available in the next few days. And this is it's a testing kit. The lead scientist is here, Dr. Raul Destura, who is also the director of the National Center, Training Center for Biosafety and Biosecurity of the National Institutes of Health. Reconfirmation will be performed at the Philippine Genome Center, University of the Philippines. So, sir, the kit, maybe it's better that he explains what he has developed.
Mr. Chair, in that case, I suggest Secretary Duque should likewise include, Secretary Duque, you should likewise include as a member of your task force as a policy recommendation, the Secretary of Science and Technology.
Yes, sir. Certainly, the DepEd, the DOST Secretary.
They just developed a kit kung napakinggan nyo kanina.
Okay, so we can vet that and make sure that the specificity and the sensitivity are according to standards, acceptable standard.
May we know, Mr. Chair, where are we on that development? Because I think this is very important na meron tayo dito sa local na nagde-develop nito. And kung nasan na tayo, and siguro Secretary Duque, as mentioned a while ago by WHO, it's important that it passes the
WHO standards and protocols. Where are we in this? Just a brief answer, siguro, sir.
Yeah, the design of technology is actually adapted from the WHO websites in terms of the global recommendation for developing test kits, for use in hospitals capable of running PCR machines. Um, this was developed 2 weeks ago, immediately after they released the whole genome sequence of the virus. The entire genomic team analyzed and reviewed and verified the probes that were already uploaded at the WHO website. So the limiting factor really was bringing in the raw materials in the country, and glad that it's already here. So we're doing the scale up and the protocol for strict manufacturing practices. And hopefully by next week it will be ready for the Department of Health to verify and validate before they give their recommendation for use to the country.
So again, by next week, you're expecting it?
Yeah.
Natapos na by next week. And after that, it will further go with the DOH.
Yeah, it has to be validated by the Department of Health.
How long is the process of validation?
We can assist their team if they are overwhelmed. The government spent so much money creating the Philippine Genome Center, so we can actually utilize that state-of-the-art facility to enhance rapid detection of unknown viruses in the future.
So by next week, next week, probably we'll be able to use it. Thank you, Mr. Chair. It's a very good information.
Secretary Locsin also wishes to be excused from this hearing. You don't have any more if there are none.
Can I just have one, Mr. Chair? Because you made mention a while ago, Mr. Chair, I think this is very important for our OFWs na nandun ho, mga may kamag-anak sa Wuhan, sa Hubei. Ilan po ba sila? Ano yung ina-anticipate natin? Kung magre-repatriate po, saan sila dadalhin? At ready na po tayo. Siguro yung efforts lang po ng DFA because kahit undocumented, of course, we are taking care of them. Siguro yung report lang na yun, Mr. Chairman, before we excuse our Secretary of DFA.
At the very moment, we're fixing the flight. Over 40 are asking for repatriation. Yes, we take them all in, and as in the case of our OFWs or whoever is out there, we do not discriminate. Illegal, legal, regular, irregular. As long as they're Filipinos, we pay. We even pay their debts because that's our job.
Chair, just with your permission. Kasi connected din ho dun sa kay Senator Joel Villar. You'll be repatriating them. Who's in charge of fixing the quarantine area?
The DOH has established protocols like the ones coming in from Hubei. They are met, they are kept, detained, and immediately brought to the quarantine facility in the north.
Mr. Chairman, if I may be allowed, there has been a composite team of the DOH, led by the DOH, the DND, and the PNP, that has gone to one of the quarantine facilities to check the readiness of that facility. And so far, I think everything is smooth sailing. I really am not aware of the more detailed requirements, but by and large, it's been okay. That's the information I have gotten. And so this afternoon, we'll find out the final status of said facility.
Ito ho yung drug rehab center sa Fort Magsaysay.
Yes, Your Honor.
Thank you, Mr. Chair.
Senator Locsin wishes to be excused. If there are none, Secretary Locsin is excused. Thank you for attending this hearing. Secretary Locsin, ito, immune po ito sa virus, si Secretary Locsin. Sa init ng ulo mo minsan, patay yung virus. So you are now excused.
Thank you very much. I thank the committee.
All heats up. And also, Secretary Guevara, if there are none questions addressed to Secretary Guevara, you are excused. May cabinet meeting pa po yan.
Mr. Chair, any questions pertaining to the travel ban or immigration questions the Commissioner of the Bureau of of Immigration will stay behind to answer these questions. And also pertaining to the matter of contact tracing, if there is any need for the Department of Health to engage the services of the National Bureau of Investigation, said bureau will be very much willing to support.
If I may add, about yung nangyari po sa Legazpi, about yung kunwaring nagbiktima siya. So, pwede nyo bang kasuhan to ng alarms and scandal tuwing may mga fake? Nung nakarang araw naman po, may nakahiga dyan na kala natin lasing lang pala. Koreano.
Mr. Chair, I will request the National Bureau of Investigation to take a look into the matter.
Para hindi na po maulit itong mga ganitong pangyayari. Nagdadagdag lang po ito sa panic ng ating mga kababayan.
That's very true. Thank you, Mr. Chair.
To Secretary Briones also needs to be excused, but I have one question to Secretary Briones. Can you give updates on the DepEd's precautionary measures? How do you educate your students and their parents in these situations? There are some schools in Manila suspending classes. What is the policy for school suspension? Does the DepEd have a contingency plan when there would be potentially massive disruption of classes?
Thank you, Your Honor, for the question. The department has had a very, very long history of dealing with emergencies, whether health or whatever type of emergencies. So, structurally, the department has an existing set of protocols already. If there is an incident, if there is a crisis, if there is a challenge, everybody moves. It is automatic. And so it's the same with this issue now of the health emergency of coronavirus. And what we have done is we always take our cue from the Department of Health, because it is the Department of Health who has the expertise. But we don't wait for memoranda or write notes or etc. I call him directly at all hours of the night or day. And it's the same with our regional directors. I deal directly with them. Now, the usual issue that emerges when there is a crisis or an emergency, and as correctly pointed out by your colleague, that we are responsible for 27.2 million learners, is the matter of suspension. And while this is in the arena of the local government officials, usually local government officials consult with us. Now, it's the same with this health emergency. In the two regions where there were confirmed fatalities, the immediate reaction was to suspend classes on the part of the local governments. And we have dialogue with them, and we advise them that it may not really be truly very helpful to suspend classes, because it will not prevent our learners from going off to crowded places because there are no classes. In school, they are monitored by their teachers. There is a reporting system, and they also learn in the process. So the local government units of these two regions have not proceeded with their plan to suspend classes unless there are really genuine emergencies. Another issue which concerns the parents and the families of our learners is the matter of national events, which usually occur during the first quarter, and most of them in January. And this will be the regional health meets, our regional athletic meets, talent contest, national level. So all the regions gather in one place. And if you think Palaro, you think 30,000 learners, as well as parents and grandparents attending, and we have been advised to um, take care with exposing our children to crowded places. So right now, the policy is for temporary postponement of all these activities because we'll be drawing in learners, teachers, as I said, family members from all regions for these athletic meets, talent festivities, and so on. Another issue which has bothered a major concern, of course, is that reservations have been made already for airline flights, hotels, and so on. And so we're looking into the legal aspects. Um, but we are very hopeful considering the developments in the way this crisis is being treated na bumababa na ang level ng mortality and it's being contained. Sunod naman ay yung matter of field trips because it's part of the curriculum of the children. Again, nagtatanong ang mga parents because they go off. Some of them go as far as Manila if they are from the provinces to observe. For example, they go to the Senate or they go to the pit and to go to the tomb of Jose Rizal and so on and so forth. Again, we are temporarily discouraging or suspending these activities because of the danger also of exposure. But we are not totally forbidding this or canceling. We're saying that on a weekly basis, we'll be getting bulletins from the Department of Health kung pwede nang magbiyahe. Kasi siyempre, even if we will say we'll go ahead with these activities because we have already spent hundreds of millions for hotel reservations and tickets and the grandparents are all set to go, there would be many families who will not allow also their children to go to the different places. Also, because of the increased involvement of our learners in international activities, they participate in contests. We now have teams of learners, for example, who are in Thailand, participating in invention contests. They participate in all sorts of things. So we also are advising them, those who are already there, to stay put, but when they come back, they should comply. Because the first thing that we teach in the Department of Education is compliance with laws and with regulations. So all of these have been considered. Yesterday, I called a meeting of all our level 3 officials down to the division superintendents. And we have now a compilation of all the issuances of WHO, of the Department of Health, the Office of the President as guides to our teachers and our learners. And finally, if this can be a source of assurance and comfort, health and hygiene are a major part of the curriculum in the department. So maybe before even any of you were born, or you were still in kindergarten, you were already taught about washing hands. And now we have our public schools always have this row of faucets outside the schools where the children wash their hands and soap is provided. So it's a built-in, the teaching of hygiene, whether or not there is an emergency on occurring. So these are what we have undertaken. For travel, we follow the orders of the President. For national events, we follow the advice of the Secretary of Health. And all other activities, we have built in, we already have protocols, we have mechanisms, and we immediately, just a final bit of news, in one of the regions where the first death from NCOV occurred, it's an excellent example of how the local government, the Department of Education, and the Department of Health all work together. And we have assured them that, for example, if they need more nurses to help in the tracking of the patients and so on, we are ready to help. So both the three local governments, Department of Education, and Health are into this, and we are able to get a lot more work done. In addition to the fact that we call our Secretary of Health, we call our regional people, we call the provincial people directly and get the data from them and take immediate action. Thank you very much, Mr. Chair.
Thank you, Secretary Briones, and thank you for your time. And thank you for attending this meeting. Also to Secretary Lopez, wishes to leave now. Thank you for your time. And just make sure lang po, yung ating mga face mask, yung presyo, yung SRP na susunod, yung mga nag-hoarding po, pakihuli na lang po ninyo. Huwag na lang po sila magsamantala sa ganitong panahon po. Magtulungan na lang po tayo. You, go ahead,
On
Secretary
that,
Lopez.
Mr. Chair, Your Honors, we continue to intensify yung monitoring, especially of the supply. And as mentioned earlier, we were able to secure supply from the local manufacturer. Now, in our continuous effort to provide more supply, we were able to also to find other sources from Thailand. What we're trying to do is basically just try to help the private sector, the drugstore. Sila po talaga yung bumibili on their own. Now, in the meantime that there is this shortage, actually we just go back to suggesting the discipline dun sa mga affected, especially those who are sick. Yung discipline of using, kung walang mask muna, handkerchief, tissue, parang talagang for them to prevent yung spread. It's their duty, responsibility, and the constant washing, the frequent washing of hands. The other related measure, Mr. Chair, sa mga ganitong pagkakataon na kunwari ang private sector mismo, kahit sila dapat ang bumibili nito, pero sila rin nahihirapang mag-source ng mga materials. The DTI, unfortunately, does not have the power to make purchases. So maybe that is something that we can also look in the future, consider in the future for emergency cases, kung may mga emergency equipment, products that the government will have to procure, maybe the DTI can be also given that authority or power to make essential or emergency purchases. And not necessarily DTI, could be the attached agency, the Philippine International Trading Corporation. Because right now, the PITC cannot do that unless may agency na magpapa-procure, who will ask them to procure, do the volume procurement in their behalf. So that is all, Mr. Chair.
Thank you, Secretary Lopez. And Secretary Bello wishes also to leave. You have a date? You're still eating. Alis si... Sabi nila may date ka raw. So, pero bago yan, sagutin mo muna ito. Ano ba yung mga plano natin pag umuwi yung mga OFW? Meron ba tayong assistance or budget na nakalaan sa kanila? Not only the Department of Labor and also the Department of Social Welfare and Development. Meron ba tayong nakalagang pondo or assistance na pwedeng ibigay sa ating mga kababayan na umuwi rito? For the meantime, naka-quarantine sila for 14 days. Wala silang trabaho, wala silang hanap buhay at bibigay po sa kanilang pamilya. Meron bang assistance?
Thank you very much, Your Honor, and the honorable members of the committee. Yung pong mga i-repatriate natin mga OFW, meron pong ready program para sa kanila. Unang-una, pagdating nila, agad-agad meron silang financial assistance. Uminsan, pagkapunti sila, umabot ng 20,000. Pero kung marami-rami na sila, we reduce it to 10,000 po. Yun ang financial assistance, immediate po. Ngayon, kung halimbawa, they have to go to their provinces, sasagutin din po ng OWA yung kanilang pamasahe. Now, aside from this, Your Honors, meron din kaming program na tinatawag na livelihood assistance. They can borrow 20,000 for their livelihood project kung meron sila at no cost, walang bayad po yan, walang interest po. Pero we also have a joint project with the Department of Trade and Industry, yung tinatawag na TNK, yung trabaho, negosyo at kabuhayan. We have this program for our OFWs who will be repatriated, Your Honors. And at the same time, ito hindi napapansin, pero ito napakalaga sa ating mga OFW, yung scholarship program for their children. Pag kayo bumalik na OFW, lahat yung anak nyo, covered sila ng scholarship ng OWA po. Yun po ang ating programa para sa kanila.
Thank you, Secretary Bello. How about Secretary Bautista?
Thank you, Mr. Chair. Mr. Chair, to answer you directly on the assistance we provide to the OFWs who return to the country. First, we have a financial assistance initially at the amount of 5,000. Then we provide them referrals for sustainable livelihood program, and apparently there will be a case management, and depending on what is the need, then we will enroll them to the different programs. Secondly, of course, the SWD work under the ambit of the chain of the DOH. So meaning to say, whatever the DOH leader says, then we perform. On our side, in anticipation for a outbreak, I have already directed my regional directors in the different field offices to designate quarantine areas using our centers. For the appreciation of everyone, we have 71 centers nationwide, and apparently if push come to a shove, we can use those centers for a transition for quarantine. Secondly, I have already directed the field offices, center offices, to prepare for quick reaction teams to augment the manpower of the DOH, particularly on caring the patient and at the same time contact tracing. With our personnel spread nationwide, apparently we can assist the DOH on that mandate. And thirdly, we can also assist in the information operation. With the different informations, news coming out, I think we have to shape the perception of the public so that we will lessen or reduce the fears and set the truth. And with the information, materials that will be provided by DOH, we can assist in the advocacy of this outbreak or NC-COVID. So that's all, Mr. Chair.
Thank you, Secretary Bautista. To General Morales, our PhilHealth President, covered po ba ng PhilHealth kung sakasakaling admitted po sila, magkasakit sila, under investigation sila, nasa isolation room sila ng hospital. And aside from that, in excess of the package, pwede nyo pong lapitan rin po yung malasakit centers natin. Meron na tayong 61 malasakit centers all over the country. Pwede nyo lapitan ito at handa po itong tumulong sa inyo. Ulitin ko, yung malasakit center, inyo po yan. Sa tao yan, pera nyo po yan. So, kindly answer, General Morales.
Thank you, Mr. Chairman, members of the Senate Committee on Health. Our board has issued the direct instructions to provide an isolation package for the persons under investigation. This is 14,000 for the 14 days that they will remain under investigation. This is the incubation period. Aside from that, there's already an existing package, a referral package for 4,000 for all patients who are referred to hospitals who are suspected of harboring the virus. So we are prepared, Mr. Chairman. We have already instructed our regional offices to instruct the hospitals levels 2 and 3 to prepare to admit all persons referred to them who are suspected of being infected by the coronavirus. So yes, Your Honor, we are ready.
Mr. Chairman, can I just please add to that information very quickly?
Go ahead.
The package for isolation is at 14,000 for 14 days, but assuming the patient's condition deteriorates, and hopefully not, for the mild pneumonia package, the PhilHealth pays 16,000, and for a serious pneumonia package, the PhilHealth pays for 32,000. So mas malaki ho talaga. Pagka yung pasyente mas may kinakailangan na mabigat na gamutan. So mas malaki po yung package.
Pag may kulang pa, lapitan nyo lang po yung malasakit.
Yes, certainly, Your Honor.
Center, Secretary Duque. Now next is the turn of Senator Panfilo Lacson to ask questions.
Thank you, Mr. Chairman. I will address my questions to the country representative of the WHO. Many governments and jurisdictions rely heavily on the WHO in the matter of public health emergency of international concern declaration. My question is, following the timelines that you presented, why did it take the WHO 18 to 20 days to declare new coronavirus as a public health emergency of international concern? Just a refresher, no? It was on December 31, 2019, when a clustering of pneumonia cases of unknown etiology was reported in Wuhan, China. And that's the reason why the following day, January 1st, the Wuhan market was closed. Fast forward, the first death was reported on January 11, 2020, if I'm correct, Doctor. Now, I go back to my question. Why did it take you 18 to 20 days to make that declaration?
Thank you, sir. To explain, as I already briefly touched on, we are monitoring and working very closely with the authorities in China to understand this new disease. As I mentioned, declaring a problem a public health emergency of international concern has economic and social repercussions. When you have a few hundred cases of a disease and you just had the first death on the 11th of January, there was not enough evidence by the time the emergency committee convened on the 22nd to conclude that this event actually constitutes a threat to global public health. At that time, the reading was that this is a problem within China, which could be contained within China. And as I mentioned, the belief was that the infection happened out of a food source at the Wuhan market. So there was no evidence of person-to-person transmission, of clear evidence of person-to-person transmission, which poses a risk beyond China. And this evidence emerged only after the emergency committee met the first time on the 22nd and 23rd. Based on this new evidence and the continuing increase of numbers of cases inside China indicating person-to-person transmission, and also confirmation of person-to-person transmission outside of China in the 4 countries I mentioned, this was the basis for WHO to decide on a global public health emergency of international concern. This has serious implications. It's a consensus decision that we have to arrive at because of the implications it could have to trade and social issues, economic and social issues. And we, our Director General and staff are very conscious of these implications, and we are very careful in determining whether an event is of significance to be classified as a global public health emergency of international concern.
It's normally your timeline to make such declaration. In the case of MERS, for example, because yung coronavirus is not necessarily a new virus. This is a progeny of several other viruses that occurred in the past or happened in the past, like the MERS, SARS, even yung what are you think? Yeah, the SARS and the MERS. You know? Is this normally your timeline in making such declaration?
To explain, sir, this is not a progeny of the previous viruses. It's just from the same family. And we had to make sure that the threat it poses is of similar magnitude. Even if you look now, the mortality rate caused, even after 20,000 deaths, this is more than double the number of cases caused by SARS, is much lower at 2% than SARS or MERS. These are factors that we need to take into account, including what proportion of people actually suffer from severe disease. And again, the proportion here is around 20%. Based on these factors, the consensus of the independent experts was that this event did not constitute a public health emergency of international concern when they first convened on the 22nd and 23rd. Their opinions were changed based on emerging evidence and new information when they reconvened on the 31st of January.
Thank you for the information. What is the average rate of increase of deaths and infections or infectiousness on a daily basis,
Yes.
Doctor?
So for the past few days, during the past week, we have seen approximately 40 deaths.
Reckoning from the first death reported on January 11,
Yes.
2020, what is the rate of increase?
Yeah, so now, during the past week, the average number of deaths ranged between 40 and 50. Just last night, for the first time, they have reported more than 50 deaths, 57 if I may recall. The number of cases shows about 2,100 per 24 hours of reporting cycle.
Which is equivalent to how many percent per day, sir? The rate of increase. I'm asking
The rate of increase.
rate of increase on a daily basis.
Yeah, so if you see that now we have 20,000 cases, that most recently it's increasing at about 10% a day over the last 2 to 3 days. Before that, the numbers increase was much lower. The issue is the capacity to test, as discussed earlier, inside China has been greatly enhanced and expanded. And China is now testing a significantly larger number of people with mild symptoms. And this is why we are seeing such an expansion of the number of people being reported as positive. We welcome this because we believe that clearly identifying who is infected is important to contain the outbreak. At the same time, we need to look at it in the context of what is being done and how it's being managed. And we are also happy to note that the mortality rate continues to reduce. So these are all good things in favor of saying that the impact could be minimal. We just need to manage now and ensure that we reach the peak of transmission, which according to some independent experts and research institutions, the prediction is that that peak may be reached within the next 10 days. After that, we expect that the prevention and control measures that have been instituted in China and outside will result in a gradual decline of cases. We are still optimistic. As you recall, the emergency committee on the 31st of January also concluded that they are confident that this outbreak can be controlled.
Are there some positive signs of cure anytime soon, Doctor?
So again, on the management side and for cure, the record with the previous two coronavirus outbreaks was that we did not succeed in developing specific treatments. But the supportive treatments that were developed and advocated helped to contain the disease and to manage and reduce the deaths. So we believe that it is important that research institutions to continue to work to find a treatment, and we welcome the report this morning of a cocktail of drugs that was used in Thailand, which apparently had good results, and I believe there are several other drugs that are being used and trialed, and we welcome those efforts to better understand what would be the most effective treatment in the management of these diseases. But right now, we don't have a specific treatment for the novel coronavirus. From the preventive aspects, the research institutions supported by WHO are looking towards the development of a vaccine. And we've heard several research institutions claiming that they have potential vaccines which could be used, including some vaccines that have undergone a lot of clinical work that were trialed for MERS-CoV, which has a similar structure. The question is whether they will be effective in preventing this disease, and that work still needs to continue.
So, considering that this is novel and of unknown ideology, I assume that you are exerting a full court press effort, in this regard, Doctor.
That's exactly what our Director General.
But there are no signs of positive signs of a cure as of the moment, as we speak.
Not yet. We cannot create optimism that is not founded on pure evidence.
I'd like to shift to Dr. or Secretary Duque, Mr. Chairman. What measures are the other countries doing that we are not yet exploring in prevention, containment, and all other areas?
This is a multi-level intervention, Your Honor, from border surveillance, where we have heightened the status of all of our Bureau of Quarantine officers and the mechanisms in place, with an additional 28 thermal scans that have been deployed in all seaports and airports. But I must be the first one to admit that I have come to observe that there are certain domestic airports that still don't have the adequate number of thermal scans. And I think in this light, the evolving nCoV, we need to ensure that all of these domestic airports must also be provided the additional thermal scans. Now, the next level, of course, would be at the community surveillance, where, as had been mentioned, the Epidemiology Bureau takes the lead. But let me just tell you that it's quite frustrating when we do all of this supposed to be whole of government approach to this particular challenge, public health challenge, since the health services and various capacities in providing these services, these have been devolved to the local government units. And I'd like to take this opportunity to perhaps for the Senate to consider. It might be time to review the local government code, in particular the devolved healthcare services. And I believe that, like the DepEd, they were not devolved, and there's even greater reason that health care, health services should be integrated and not fragmented as it is today, where the coordination efforts begin to pose serious problems, because the LGUs will invoke their autonomy. They will invoke that they have to be asked permission every now and then. So very frustrating, ano? Kaya mas maganda ho siguro na aayon na we will really review the local government code. And then the third level, sir, is on case management. From the
Mr. Chair, if I may, Mr. Chair, quickly interject with the indulgence of Senator Lacson.
Go ahead, Senator.
Just a quick comment po that it may not be necessary to review the local government code, particular dun sa devolution ng health services, kasi nga, kapapasa lang natin ng Universal Healthcare Law na isang parang paggamot kahit papano nung devolution of health services. In fact, baka pwede nating, Chair, tignan na test run ito ng implementation ng Universal Healthcare Law, ng pag-respond niya dito sa 2019 nCoV. Thank you, Mr. Chair.
And to add to that, na-devolve yung function, naiwan naman yung pondo. That is the problem. Whenever a person that would like to seek medical help or assistance, when they go to their local government executives, sasabihin sa kanila, na-devolve yung function, pero yung pondo nasa DOH. And when this person goes to the DOH, hindi rin i-entertain. Sasabihin, wala na ho sa amin yan. Pumunta kayo sa local government unit. That is a problem.
Ang initial response, policy-wise, is that kaya po nagpasa po ang Kongreso ng Universal Social Health Insurance Law. Precisely, it's also one of the interventions, as Senator Riza has mentioned, na to somehow resuture the mangled parts of the health system of this country. And it's been successful to a certain degree. But the funding integration, the funding approach is not sufficient because the supply side is again the big problem. Under a fragmented system, ang nangyayari po kasi, halimbawa, ang mayor, hawak niya ang supply side ng barangay health station and mga rural health unit. Samantalang ang gobernador, ang district hospitals and provincial hospital. Ngayon, under the universal healthcare law, we have seen this as an obstacle because some mayors are in fact saying, no, we don't want to integrate because they're again invoking
Again,
local
another
government.
problem, Secretary, is yung funding gap. Di ba, we discussed that during the budget deliberations. How much did you receive under the 2020 budget for the Universal Healthcare Act, under the Universal Healthcare Act?
172 billion.
What is the funding gap?
The fund gap would be about
100 plus billion, di ba?
hindi naman po, kasi 257, so
Yeah,
that's about
257.
80 to 90 billion. Sir.
80 to 90 billion.
Yes,
How
sir.
would you cope with the situation?
Well, we are actually expecting additional funding. The proceeds from the implementation of sin tax
Okay.
is one. But the first year of the implementation of the sin tax law will only yield, I recall, from the DOF, about 20 billion. And that is hardly enough, Your Honor. But just the same, since we are progressively rolling out the universal health care, we might be able to make it to survive because, as again, the law does not expect us to roll out nationwide on the first year of implementation, Your Honors. So I think this will give us ample time to make the necessary adjustments given the budget limitations. And hopefully, in the succeeding years, the budget gap will be addressed more
Thank you.
adequately.
It's already 3:10, Mr. Chairman. My last point. Yung returning Filipinos and residents, they're allowed to enter the Philippine territory provided that they should subject themselves to self-quarantine. What exactly do you mean by self-quarantine? Isn't this an impractical approach? Kasi pag self-quarantine, bahala na si Pilipino na bumabalik.
I was told by the EB that meron daw pong nag-check sa kanila na mga surveillance officers natin. But I have to check that on the ground. And I'm very interested to find out, Your Honors, that this is not just being said, but actually being done.
Especially that this is asymptomatic.
Yes, sir.
The Filipino returning resident wouldn't know if he is a carrier.
But there is an evaluation tool, a decision tool. For example, number one, kung wala kang lagnat, okay, negative, wala kang ubot-sibon, pero galing ka ng, doon una nga, interim guidelines namin, kung galing ka ng Hubei, okay, mapapara ka na, okay? And then, if you have one of the four other exposures, which means you have been directly in contact with a known case of novel corona infection, or if nakihalubilo ka sa isang ospital na natukoy na nakilala na nangalaga po ng novel coronavirus. Pangatlo po ay kung ikaw ba ay nagpunta doon sa live animal market, seafood market, at kung ikaw ba ay humawak ng mga hayop na sa ngayon ay natukoy na nila na galing sa hayop na posibleng one of the exposures. So meron po tayong magandang, I can give you the decision tool just to appreciate how we are guided to execute different interventions at the 7 levels. The level of border surveillance, the level of community surveillance, the level of contact tracing, the level of case management. Napaka-importante po ng case management. At the level of leveling up laboratory diagnostics, as we have discussed a while ago. And then, of course, yung case management, I've said that, kailangan pagalingin ho talaga. Yung mismong intervention on the ground, yung supportive treatment, etc. and then the prevention and mitigation. So different levels, different interventions po, Your Honors. And gusto ko lang din, I want to take this opportunity, sir, na of all of this, I think the most difficult is contact tracing. Hindi po talaga ito madali. At
Huwag nyo na ibalik yung topic dyan. Baka bumalik na naman sa inyo. Anyway, the practice of Indonesia, yung measure that they're employing in spraying their returning residents with antiseptic, it's rather, it is quite a extreme measure, so to speak. But would you find it more effective than what we are doing?
Your Honor, I have to find out
Tuloy
exactly
quarantine po yun, ha?
what is the chemical.
Diretso sa Natuna Islands, military base.
Yes, sir. I will have to find out, sir, kung ano po yung chemical na ginamit. Kasi kung yung chemical hindi naman naayon doon sa safety standards,
I
baka...
suppose it goes without saying, yung chemical gagamitin nila para dyan sa prevention or containment.
Yes, sir. Pero hindi natin alam, mga chemicals ngayon, meron din mga side effects, toxic effects. So we'll have to balance it out, no?
Secretary Duque, baka pwedeng tumulong yung PNP sa monitoring po dito sa mga self-quarantine, sa tracking. Yung PNP natin, baka pwedeng makatulong dito sa self-quarantine natin sa monitoring. Yung Philippine National Police.
Yes, sir. Kasama po, bahagi po ng aming kasunduan sa Interagency Task Force, ito po si Secretary Ed Año, na yung pagbubuo po na tinatawag natin Novel Coronavirus Task Force at the local level, yan po ay pwedeng isama sa kanilang mga activities. Ito pong surveillance and other important intervention.
Mr. Chairman, may I just point out something because the question a while ago raised by Senator Ping, tama ba, maayos ba na ipatupad yung pagdating ng mga kababayan natin na galing sa mga lugar na yon na infected or present yung coronavirus, magsi-self-quarantine? I think hindi yun nasagot ng maayos Tama po ba? Because right now, we want...
Thank you. Napansin ko rin po yun, hindi yung sinagot.
Kasi ilan yung naka-self-quarantine? Ilan yung pumayag magpa-self-quarantine? Kung yun nga po kaninang tinatanong natin na kasama doon sa loob ng eroplano, 17% lang yung na-contact. How much more yung conversion mo na dumating dito, sasabihin mo na magpa-self-quarantine ka at susunod ka and aasahan mo na talagang susunod siya. So we wanted to find out, again, go back to the main question. Tama ho ba? Ito, pinag-aralan ba natin to na, sige ho, pag dumating kayo dito, mag-self-quarantine ho kayo?
Yung self-quarantine na kasama po yan sa protocol natin. Dahil kung wala ka nga naman sakit, sasabihan ka, manatili ka muna sa bahay mo, sa isang kwarto. But you have to take your daily temperature. You record your daily temperature, and then you watch out for signs of coughing or for colds and other signs and symptoms that may suggest respiratory illness. Pero ang mahalaga nga po rito, yung EB officer natin, tinatawagan yan at tinatanong yan, ano temperature mo today? 14 days gagawin yan just to make sure. Ngayon, kung meron ka ng
meron po tayo, nakaset po yung sistema
yung
na
po ang akin
and do you expect
kaalaman.
that person na nag-decide na mag-self-quarantine would do what you're saying?
I think for their sake, they should. They should do it because
if they are sick, if they are feeling uneasy. But if they are not, as we made mention a while ago, if it's asymptomatic, so right now, siguro, just to make sure that we have the systems in place, right now, how many are undergoing self-quarantine as we speak, yung latest data?
This is quarantine. Ilan? Amini. Ilan ang naka-quarantine ngayon?
Yung home quarantine?
Pakidagdag na rin siya, tatanungin nyo, yung health declaration checklist, ba't nyo pinatanggal yon?
Dati,
baka makatulong ngayon yun.
Talaga makakatulong po yun. Dati, hindi ko lang
Pero
malaman.
pinatanggal nyo po
Ang Bureau of Quarantine probably has the historical or institutional memory.
Yung yellow
yellow.
checklist.
Mr. Chairman,
Secretary,
Mr. Chairman, may I just on this point? Perhaps, Mr. Secretary, the point being raised by Senator Lacson and Senator Villanueva is di tinatanong nila kung maayos, no? I think the point is, why don't you review it? The self-quarantine procedure that it's included in your protocol. Kasi self-quarantine, sinabi ninyo, sumunod siya, umuwi siya, di siya lumalabas ng bahay. On the 11th day, ang taas ng lagnat, may ubo sipon. Nagpa-check ngayon, meron. Ang kasama niya sa bahay, 7. O, paano kayo yun?
The real challenge.
Times 7 ninyo yung self-quarantine. Yung nag-self-quarantine, di ba? So, the point probably of the gentleman is pag-aralan niyo yan, mukhang hindi effective yun, delikado yun. Thank you.
We'll do, Your Honor. We'll do, Your Honor. We look at the gaps as we execute, we implement, and we will continue to review the systems.
Secretary Bello, Secretary Anyo, and Governor Kua wishes to be excused already. If there are no questions to them, they are hereby excused. And thank you for attending this meeting, Secretary Anyo and
Mr.
Secretary
Chair.
Bello.
Ako may isang question sana
Just
kay
one
Sec.
final
Bello.
point lang
Kanino
before
po?
I terminate my interpellation. Pakibilisan nyo lang kasi para mawala na yung second death, third death, fourth death. No, pakibilisan lahat yung gawa. Salamat po. Yun lang.
Maraming salamat po for the reminder, sir.
Okay na? May tanong ka pa? Okay, go ahead.
Just
Secretary Bello.
is it my turn or was just to ask
And,
question to
one more
Secretary?
last
Yeah,
question.
because I'd like to put this on record and would like to commend the Department of Labor and Employment for acting very quickly on the Labor Advisory number 4. I think a lot of our people are listening and attentively watching this hearing. Perhaps if the good secretary would give this information, Mr. Chairman, I think it's very important, especially for our workers, make sure that they are being protected.
Thank you, Your Honor. As mentioned by the Honorable Senator, we issued the Dolly Advisory number 4, series of 220, and this is basically addressed to the employers, Your Honor. And this is a guideline for the care of workers when they are reporting to office. The employers are required to monitor the health condition of their workers, particularly those with fever, flu symptoms, and those who have traveled to or work in countries affected by NCOV or novel coronavirus, and in the event that the worker is suspected as having reported using the DOH hotline. This is also, Your Honor, and the guidance of the use of leave of absence. Kasi kung minsan, Your Honor, yung worker na ubus na yung kanyang leave benefits. So we are advising the employers na for humanitarian consideration, pagbigyan nyo naman yung worker na go on leave even without pay. There also, Your Honor, we also provided in this advisory yung social benefits of our affected workers, yung sa PhilHealth, sa SSS, and also sa ECC. Then finally, Your Honor, we have also an advisory on the technical assistance that we allow or grant to our workers. And this includes yung kanilang education on respiratory program, capacity building, and including information on this NCOV, Your Honors. Yun po. Ayun po ang aming advisory po.
Thank you, Secretary Bello.
Meron din po kami, Your Honor. Dagdag ko lang po.
We would
Your
like to
Honor.
acknowledge Senator Ralph Recto. And Senator Bato, it's your turn to ask questions.
Thank you, Mr. Chair. I have no more further questions to Secretary Doki. Naawa na ako eh. Masyado na siyang na-stress. But anyway, uh, please don't feel you're being crucified in this issue. We just have very high hopes on you na you are going to save the Filipino nation from the scourge of this coronavirus. Kaya
Thank you for the confidence, Your Honor.
yeah, we know that you need the help that you can get from all sectors. Uh, tinignan ko nga according to the British Encyclopedia, Doc is the nobleman with the highest rank. Kaya napakataas ng expectation namin sa iyo na masave mo yung aming mga anak at ang buong Pilipinas from this scourge. Kaya isa lang hiningi ko sa iyo para mabawasan yung pagkapraning ng ating mga kababayan. Please, as soon as possible, i-account mo yung lahat ng pasahero na kasama nung Wuhan couple. And to do this, I strongly suggest that you use the interagency task force to the health. Andiyan yung PNP. I guarantee you, andito yung number 2 man ng PNP. Give them the list, the manifest, within 48 hours, sigurado ako, ma-account na lahat yan. Kung hindi lang lumabas sa ating Philippine territory, accounted agad yan lahat yan. Dahil hindi yan mga kriminal. Ma-account nga nila yung mga kriminal na nagtatago. Yun pa kayang mga pasahero na walang kasalanan, hindi magtatago yan. Kaya napakadaling account yan. Baka 24 hours, accounted lahat yan. Gamitin mo lang yung interagency task force.
We will do that with your
Please,
assurance, Your Honor.
Bilisan mo lang, sir, dahil yung mga tao na papraning. Yun lang, sir. Maraming salamat. Thank you.
One more question from Senator Joel Villanueva.
Mr. Chairman,
Go
this
ahead,
is the only
Senator.
time I'm taking my 5 minutes.
Yeah.
Mr. Chairman. So thank you. Mr. Chairman, let me go back doon sa binanggit ni Senator Bato. We are here to help, Secretary Duque. We are here to support our department, especially the Department of Health. But we are as disappointed as you are, as I saw your reaction kanina doon sa binibigay na information. Again, I think the 17% na accomplishment rate at this point in time, just to figure out kung nasaan at kontakin itong mga pasahero ng airline na company na ito, hindi pa rin nagagawa. Siguro, sir, just to give you another ammunition dun sa sino man ang nagpayo sa inyo doon sa Data Privacy Act. Dito ho sa Data Privacy Act, Section 4, letter E, point out ko lang po that the Data Privacy provides that the Data Privacy Act does not apply to Section 4, letter E, information necessary in order to carry out the functions of public authority, which includes the processing of personal data for the performance by the independent Central Monetary Authority and law enforcement and regulatory agencies of their constitutionally mandated and statutorily mandated functions. Siguro magandang ibigay niyo po ito dun sa nagpayo sa inyo kanina tungkol po dyan sa Data Privacy Act. And perhaps if we can get a commitment from you, yung 11%, kailan magiging 100%, baka pwedeng malaman po natin, no? Kailan matatapos itong 100%, na tingin ho ng lahat dito, hindi lang mga senador, pati ho yung mga kasama yung resource persons already spoke kanina, na madali naman at kaya naman pong kunin. Hope we get your commitment, and perhaps if we can have a timeline, that's better.
Yes, Your Honor, we are committed to do this. Kasi as I pointed out, and the records will bear me out, yung performance naman is not really that bad. Except for the flights. Dito lang kasi, noong unang agreement, ang rule of 4. Sinabi sa akin malinaw, 4 sa harap, 4 sa likod, 4 sa tabi, noong mga naging positive. So, tataka ko, ba't naging 331 on the basis daw na baka naglakad daw yung pasyente o yung positive at baka nakahawa. Not understanding that they are human resource constrained. May constraint, kulang sa tao. Why will you do something that you know you cannot? So, ako naman po, I'm juggling too many things also. Hindi ko naman, I'm trying to put all things and, come up with a framework, operational framework and monitoring. And this was something that nagulat ako. Ito lang naman, isang ito, yung sa flight. But we will do something about this. Rest assured, we will make the quarantine or the contact tracing as soon as possible.
Can we get a timeline, Secretary, to reach the 100% from 11%, 17%?
Okay. General Bato was saying in 48 hours, he can mobilize the police force to complement the efforts of our epidemiology bureau. So we'll try in 48 hours.
Go ahead, Senator Bato.
With the indulgence of my esteemed colleague, kunti lang. Sir, Secretary Duque, yung nililimit ninyo na gusto nyo 4 rows to the back, 4 rows to the front, 4 rows to the side, to the left, to the right. Alam mo, kung yung pasahero na yun, ako, nandun ako sa front, siya nakaupo sa likod, pinakalikuran. So malayo ang distance namin. Pero doon sa passenger lounge, matagal kami magkatabi doon. Nag-usap-usap kami doon sa passenger lounge,
Senator
sa
Bato,
VIP.
paano pag nag-CR siya?
Nagsama kayo doon.
CR, pag hawak niya doon sa... Wala na. Damay na lahat yung nag-CR.
Hindi. Ito po kasi, kagaya na sinabi ko kanina, there is a 7-level interventions. So, pwedeng makalusot doon ka sa contact tracing mo, pero meron kang ibang mga interventions, di ba? Kung nagkasakit ka, dadalhin ka na sa ospital, ikagawin case management ka na. O kung hindi naman, meron kang mask na sinasabi na kung may sakit ka, kasama sa advisory. No? Na you wear the mask, you monitor yourself for 14 days, you watch out for symptoms, the EB officer will monitor your situation or your clinical course. So marami ho tayo, yung washing of the hands, this is the preventive measure. So I think the way to appreciate this is in its wholeness. Yung lahat ho ng mga interventions, hindi in isolation of one and say that parang ito lang yung magiging gagawin ninyo. Kundi in the whole context of the 7-level interventions. Thank you, sir.
Actually, Mr. Chairman, just on that point, very quickly lang. You know, that flight came from Hong Kong. For all you know, you had 15, 20 asymptomatic patients or passengers. And therefore, to you know, you err on the side of caution, you go the whole mile and figure out where these 300 are. I mean, that's, you know, you cannot try to minimize the problem and say, apat lang, dito lang. Eh kung 15 nga o 20 galing doon, puro asymptomatic, di lahat yun nagkahawa-hawa. And that's why that 17% of having covered or contacted 17% of those passengers is completely unacceptable. At this stage, 15 days, 14 days after he arrived here, no? And we had known.
Your Honor, let me just talk a little bit more about the nature of the virus. Kasi ito po, droplet. So, yung kanya this is not like measles. This is unlike TB or chickenpox. That it floats in the air, pwedeng talaga makahawa ng malayuan. Pero ito, very limited, yung droplet infection. Yung, kaya nga, nagkaroon po nung protocol.
I have been reading on the disease since it first broke out, since the outbreak started. So I am familiar with how the transmissions, and precisely why I said, this airplane came from Hong Kong. We don't know who the passengers were apart from those two. So you cannot tell me now that hindi siguro nahawaan yun kasi hindi umaandar yung sa air. We don't know that. And the only way we can determine whether he or she is infected or not is to trace that person or those persons and figure out whether they're okay and monitor. That's precisely why you have to trace them.
We will do that, Your Honor.
Thank you.
And we have the assurance that 48 hours, Secretary Duque. Anyway, let me go to another point, Secretary Duque. What is an average cost of healthcare support or call it treatment provided to the itong PUI for this NCOV? Mga magkano ba are we talking about? How much does it cost also to provide yung treatment support. And I'm asking this question because a while ago, Mr. Secretary, you made mention about allotting 2.25 billion pesos. I wanted to find out what's the basis for this. Initial lang ba to? Ano ba yung pinaghahandaan natin? Because again, we are here to help you, help the department, help the interagency task force.
Again, depending on the interventions, Your Honor, but zeroing in on the personal protective equipment, as I have said, the assumption is there will be 5,000 healthcare workers, frontliners, no, to take care of the patients. At 1,500 pesos per PPE, a set of PPE, that will give you 7,500,000 pesos. But the second assumption is this whole episode is going to last for 90 days or 3 months. So you multiply 7.5 million by 90 days, you have 675 million pesos. Now, you cannot care on an 8-hour basis alone. It has to be round the clock. So you multiply by 3 shifts and thus giving you 2,025 million pesos. So yun po, ang N95 kasama na po sa PPE.
So,
Pero on the
in
one
what
hand,
you're saying, sir, that's the preliminary and no? Initial lang po yan, meaning to say it could you might be needing more as we progress. Thank you. And we wanted to know that, sir. No, you're talking about, and please correct me if I'm wrong. Based on our data, there are about 70 DOH retained hospitals. Is that correct? 70? 73. Is it 70? 73? Is that correct?
73.
3, Your Honor.
About 73.
Yes,
And what
Your
is
Honor.
the doctor-patient ratio in these hospitals? And we asked this question because, Mr. Chairman, this is in aid of legislation. We wanted to find out how we'll be able to help the department and the interagency when the needs arise.
I'm just getting the more...
Perhaps maybe we could just give it to us later,
Gladly,
Sir
Your Honor.
Secretary. And perhaps the next question would be, what would be the ideal doctor and patient ratio, Mr. Secretary? Kahit mamaya na lang po para makabilis po tayo.
Senator Pangilinan, do you have more questions? Go ahead, Senator.
It's okay. I'll wrap up my questioning, Mr. Chairman. But give me just one issue that I'd like to raise. We are anticipating yung mga quarantine centers, no? And was mentioned a while ago yung Fort Magsaysay that can accommodate about 10,000 individuals. Other than that, meron pa ho ba tayong tinitignan at ano yung ina-anticipate natin? Do we have a rough estimate figures as to how many are we estimating? Especially kung pabalikin na po yung mga kababayan natin, magre-repatriate tayo. What are your proactive steps, Secretary, as head of the interagency?
Well, we're looking at in Mindanao, but of course, we have to consult with the governor sa Bukidnon. We also have a TRC. It's a relatively very new, complete. It's a very nice facility. It's one possibility for people who might be infected in Mindanao or not infected, but those who might have the exposure to be kept there initially. But here in the we looked at the Caballo Island as well, but kailangan marami pang gawin dito. Yung po maganda yung sa TRC ng Fort Magsaysay. And the one of the set of buildings there, yun po yung gagamitin namin yung phase 4. So yun na po yung inihanda. Meron na po palikuran yan, meron na po kitchen. So akin lang po sisiguraduhin na by the time our repatriated compatriots come, handa na po ito.
What we are just saying, Mr. Secretary, is that siguro to summarize one word is anticipate. Let us anticipate
Yes,
this scenario at maging handa po tayo, no? Lastly, Mr. Secretary, yung sa testing, binabanggit niyo po, RITM pa lang so far ang may capacity. RITM.
Yes, sir. Yan pa lang po. sa
And
ngayon.
ang maximum capacity niya is 3,000.
3,000 with the given the stock of the RNA primer in store.
And are we looking at the possibility of duplicating itong ginagawa ho ng RITM dito sa 73 kung meron man capacity, yung ilan sa ating mga DOH hospitals?
Meron po tayong 5 subnational laboratories.
Okay, so are you looking at operating these 5 subnational?
certainly.
By when po, Secretary? Ganda na yung may time frame ho tayo.
So it's about 8 weeks because they have to be very sure about the test results, the accuracy. Kasi pagka hindi accurate, delikado po tayo. Kapag,
Mga 8 weeks po,
mga 8 weeks
Secretary.
po.
Okay. Mas mauuna yung sa UP siguro, no? Thank you, Mr. Secretary. Thank you, Mr. Chairman.
Next is Senator Kiko Pangilinan.
Thank you, Mr. Chairman. I have a few questions to Secretary Duque. You mentioned earlier that there are 80 persons under investigation. How many of these 80 came from Wuhan?
Can I just ask my for the detail? Ilan ang
Shouldn't that be basic information? That of the 80, 20 or 10 or 5 came from Wuhan, similar to the
tracking, but I just wanted, because it's very fluid, yung kasi araw-araw may na dadagdagan.
But can we have the number? How
Yeah,
many
as
came
of-
from Wuhan?
He's looking at it now as of
And the follow-up to that while they're looking is, what flights did they fly in from? Did they take? Is there also an effort? Assuming, I don't know, I don't have the answer, so you can. Was there an effort also to trace the passengers in that flight? If there are others from Wuhan who are included in this 80 under investigation.
Your Honor, they're guided by the flight manifesto, and I was told that they do have the flight manifesto. But the first answer to your question, how many from Wuhan, that's a very important question. I'm just getting the data.
It's a very important question which we would have expected by now that the Secretary of Health would know.
Again, forgive me, Your Honor, because of the enormity of the multiple operating systems that we need to put in place to mount, again, a more effective response. My apologies, Your Honor. Ano pa? My people are getting very nervous, Your Honor. They're
So they
almost,
don't know.
No, they know. Meron naman, sir. May nga nagkakamali sila ng pindot.
Uh,
We'll get back to you with my assurance.
Yes, but this really is this is quite disturbing that the Secretary of Health is not familiar with how many of these 80 persons under investigation actually came from Wuhan. That's basic.
Your Honor,
How do we stay on top of the situation when the fundamental or basic information is not even in our fingertips?
yes, Your Honor, but we
What if the number is 80?
No, sir, because we have Germans, we have
Precisely, but we
Americans,
don't know.
Filipinos. Yeah.
Okay,
No,
well-
we have. We will give you the list.
No, you don't know. I'm
No.
sorry, Mr. Secretary, but you don't know the answer.
Because every day it changes. We have a tracking mechanism. It changes every day because, especially because.
How can it change every day that he came from Wuhan? He came from Wuhan. That won't change.
Well, the two with positive nCoV results, dalawa lang sila. Dalawa lang po sila.
So far, that's why we are monitoring the persons under investigation. So anyway, we would like to have that information submitted to the committee.
We will do
We
that.
would like to know, and I think the public deserves to know, how many of those 80 came from, would be similarly situated as the other two, who ended up being positive for the virus, so that we know exactly the extent. And I don't know if other members of the cabinet or the interagency are aware of this, because they should be aware of this too.
Ilan?
If the Secretary of Health is not aware of it, what about the other secretaries who are tasked to address the problem?
1 out of 80, Your Honor.
Are from Wuhan.
Yes, Your Honor. Let me also just add, Your Honor, with your permission, Mr. Chairman, that we have already expanded the from Wuhan to the entire China.
Yes. And
So,
so the next question, which I raised earlier, is of these 31, have we also tried to contract? Did they come by airplane? Did they arrive here? What aircraft? Do we have these details? 31 came from Wuhan. How did they arrive? By aircraft? Which aircraft? When did they arrive? Do we have that information?
I believe we have that information, but the details is something that we need to generate and put it in a report that we would like to submit to the committee, Your Honor.
And we would like to know if they came from aling airlines, alam ba ng publiko, sino yung mga sumakay dyan?
Meron na pong pahayag ang PAL and Cebu PAC as to the flight number. That's why they were able to farm out this
So this is
information.
the flight number of the two, but the 31. The 31 under investigation who came from Wuhan, when did they arrive? Did they arrive by aircraft? What aircraft? Who were the passengers? Shouldn't this be part of the effort to be able to trace?
The Bureau of Quarantine has this information because as soon as the passengers
Yes, because the only information that we have received so far is for the two aircrafts, Philippine Airlines and Cebu Pacific. Perhaps because they're still under investigation, therefore you don't need to, I don't know what your protocols are, but at the minimum, you must know what the aircraft, and you may not have to publicly announce it, but the committee would be interested to have a copy of these aircrafts, these airlines, when did they arrive, to give us a better sense of what we're facing. I hope that these 31 don't end up having the virus too. I hope they turn out to be negative. But we have to prepare for the worst case scenario. What if these 30 all have the virus?
We'll take care of that.
Then we have to, but that's moving ahead of the situation. So let us prepare for the worst, Secretary.
Yes, thank you for the reminder. I was told that most of these Wuhan residents have already gone back to China.
So, but they're under investigation.
But only some. We have one in San Lazaro who was tested positive.
So
we could not release her until the test yields a negative result.
Okay. So this 31, the 80 persons under investigation are no longer 80. It's less than 80.
The 80 patients under investigation, Your Honor, positive cases, 2 negative cases, 30, which means umalis na. Less 30 and pending results, 48, over 80.
Okay, so in other words, how many are still here?
This is 48 with pending results.
40.
48, Your Honor.
Okay, so we don't have to announce the information, but we would like to get this information of those 48 who are still here.
Certainly, Your Honor.
You said 31 came from Wuhan, and they're still here. I mean, some of them might still be here, and some may have left.
We'll give you the details of this, Your Honor.
Okay. So if they turned out asymptomatic, the chances are they are not as nakakahawa or infectious. Tama ba yun?
O walang sakit. hindi sila tinamaan o kung may iba like this particular
Pero
case,
the
pwedeng
chance-
cough and cold, gano'n lang.
But the chances are they too can infect others. There is a possibility.
Yeah, there's a small
Okay.
chance.
So with that, then therefore the Department of Health, the 31 who came from Wuhan, may I suggest you gather as much information you have about them. Where did they go? What did they do? Where did they stay, etc. So that we also have a sense in the event, and we are able to monitor, right? I mean, we want to stay on top of the situation. I know it's impossible
Yes,
to
Your
be
Honor.
able to address all, but we're talking of percentages here. If we can address a significant amount, then we're also significantly helping contain the disease. The other question is, do you have records of how many flights from Hong Kong, from Shanghai, from Beijing, entered the Philippines in the last 2 weeks? Do we have that information?
I think the CAB would have that information.
No, but shouldn't you have that information?
Oh, sure. When it comes to the citizens that have disembarked, we already subject them to the quarantine measures. So we get their yellow
Can you
card.
submit to this committee the number of flights from the coronavirus affected cities and countries
Will do, Your Honor.
that came in the last 2 weeks, particularly, of course, in the epicenter, the ground zero, so that we have a better sense also of exactly how exposed we became. I mean, I want to know if there were 1,000 flights that came in the last 2 days. I mean, last 2 weeks. I'm not saying it's 1,000, pero kung 1,000 yung dumating, times 200, di ba? Ganun karami ang pumasok, labas. This also gives us a better sense kung ano yung volume at ano yung dapat natin gawin.
Will do, Your Honor.
Okay, thank you.
With the indulgence of Senator
Just one more
Pangilinan.
question. Just last question.
Yeah,
Just to
kindly wrap.
Yes. Thank you, Mr. Chairman. The World Health Organization has already declared what is the declaration? Public health emergency. That's correct.
National concern.
Yes.
Your Honor.
Our Republic Act 11332, the Mandatory Reporting of Notifiable Diseases and Health Events of Public Health Concern Act, well, it's very long, provides that the Secretary of Health can make a declaration of epidemic or public health emergency. With the World Health Organization already saying there is a international concern, will we follow? Will we also declare a public health emergency in the country? What is your take on this? Because the law says, Section 7, the Secretary of Health shall have the authority to declare epidemics of national and/or international concerns.
Your Honor, since a very difficult question, Your Honor, admittedly, but since we still don't have a local case of this particular coronavirus, we have to look at the parameters for the declaration of the public health emergency, but we're nimble to making that declaration as soon as the parameters are there. And right now, we have no local transmission of the novel coronavirus. Both of them are imported cases, Your Honor.
So we at least that is on the table as an option for us to better address this health concern as it develops. Hopefully, as the WHO representative said earlier, some experts are saying this might reach its peak in the next week or so, and may or may not, we don't know, may dissipate. If that's the case, then the emergency may not be necessary, but that is still an available option.
Certainly, Your Honor. We will take that option with the guidance of the WHO.
And especially since the World Health Organization has already declared a public health emergency of international concern.
In fact, Your Honor, despite the WHO's declaration of a global health emergency, they did not recommend trade and travel restrictions. But be that as it may, the DOH and the task force had recommended very strongly to the President that we ban travelers and persons coming from China and its SAR.
Finally, meron bang emergency hotline ng DOH?
No. It's 711 001 and 711 002.
May I suggest na you man them 24 hours and get
Yes.
maraming may mga agam-agam, kinakailangan lang may makausap at mabigyan ng tamang abiso tungkol sa bagay na ito. And siyempre lahat sisipunin, hindi naman lahat, maraming sisipunin, maraming gaganit. Dapat merong emergency hotline at makakasagot kaagad ang Department of Health para yung kaba ng ating mga kababayan ay meron silang pupuntahan. Meron silang pwedeng matanong. Pagka ganun lang, makakatanong sila, mababawasan itong takot at agam-agam.
In fact, a corollary to that, the DOH Health Emergency Management Bureau's Operation Center is 24 hours operational.
Thank you, Secretary Duque, Senator Pangilinan. One more question from Senator Recto. We have to wrap.
Yes, thank you very
in a
much.
few
Mr.
minutes.
Chairman. I will be very quick, I'm sure that many have been discussed already here on the issues. Just for some information, Mr. Secretary, is it correct that roughly 20,000 have been confirmed to have the coronavirus nationwide, globally? Roughly about 20,000.
Close, Your Honor, but it's 20,400,
Okay.
Your Honor, as of today.
And is it correct to say that 99% are in China?
That's true.
99%?
Yes, sir.
Okay, thank you for that. Second issue is that, and how many have died?
425.
And 99% of them are also in China.
Only, well, two now, because there's one in Japan, accordingly.
One in Hong Kong.
Hong Kong and
In
Philippines.
the Philippines.
Yes.
Okay.
So that should be safe to assume that 1% is
Okay, so roughly 99 point plus is in China. Okay, now. And how many are severely or are sick severely from this virus?
about 2,800, roughly, that's about less than 10%, about 10, 12%.
No, about 14%.
Yes, roughly.
So 14% malubha ang sakit. Okay? Doon sa malubhang sakit, because it would appear that those who have it, only 2.4% will die. But if you look at it from yung malubhang sakit, the numbers are higher. Is that correct? So ibig sabihin ba yung may malubhang sakit, 2,800, are they in the ICU? Would you say?
Some of them I should like to believe, but they must be in isolation rooms
Yes.
with ICU capacity.
Correct. Okay, so, therefore, 15% na nahawa nito, roughly, based on the statistics of China, malubha ang sakit nasa ICU. Okay? And roughly, what? How many percent? 400 yung namatay. So, about 20%? 15% of those na may malubhang sakit ang mamamatay.
So 424,000, that's about 20%.
Okay? Now,
20%.
Now, for the WHO, the
15%.
Okay. So mataas din yung mortality rate. Okay?
Among the serious cases.
Correct. Okay? Now, because it would appear that only 2.4% ang mortality rate.
Oh, it's down to 2%, one-third lower than
Yeah,
it used
based
to be
on
last week.
those who have the virus. Now, all that data is 99% based in China. Is that correct? Okay. Now, and it would show the ability of China to respond to the crisis. Would you say that would be correct? Now, for example, if in Hong Kong, there are, how many cases in Hong Kong? 15? Roughly, confirmed. And one died. Would you say that the mortality rate is 6% then in Hong Kong as of the moment?
6%, one of
15.
15.
So more or less 6%. Of course, the numbers are too small yet, no? But that would be the current mortality rate in Hong Kong, 1 in 15. And that will show their ability to respond to the crisis. In the Philippines, how many have been confirmed?
We have two.
Two.
Yes, Your Honor.
And how many have died?
One died.
And based on
Saturday.
current statistic, alam ko maliit na numero yan. Dalawa lang. But wouldn't that be a 50% mortality rate?
It's a 50% mortality rate, but since you have two
Correct.
imported cases,
Understood.
both.
Understood. Okay. Therefore, it also, this mortality rate would depend on the ability of the country to treat those patients. Okay? And in the Philippines, if we have had two already, considering how close we are and how many in the last few months, flights from China coming over here, and we know it's 99% there. Why did it take us too long to ban those flights coming into the Philippines?
With the permission of the chairman, can we have the slide to show the relative dates of when the other countries, as well as the Philippines, impose a ban? Some countries kasi restriction lang, and only Hubei province. So iba-ibang response.
No, yeah. I understand that.
Ang Philippines, together with South Korea, Japan,
Okay.
USA.
So let me just move on to the next. No? Meron na bang cost to treat the patients? How much does it cost to treat a patient?
We haven't done the costing, but we can do that given that we have one patient. We might be able to establish the cost to care, to treat the patient.
And then last question, Mr. Secretary. You mentioned that there are 80 persons under investigation earlier.
There are patients under investigation,
Yes.
Your Honor.
And those patients under investigation, did they come to our hospitals? Sila mismo ang pumunta sa atin.
They're all admitted in the hospitals.
Yes, meaning to
But
say,
the
we did
manner-
not seek them out, no? They went to our hospitals. May sakit sila, pumunta sa atin.
They underwent screening, and some
Yes.
went there on their own because
Correct.
they knew, they were advised that
Correct.
if you were sick, you have to go to the hospital.
Correct.
But others, they were guided to the
Correct.
hospitals.
And when they went to our hospitals, were our hospitals already prepared for them?
Oh, yes, of course, Your Honor.
We knew that they were coming?
No, well,
Did we seek them, or did they just go to the hospital?
we have a protocol that I can submit how to be guided as to when you're supposed to bring these patients once the symptoms are manifest. And so there are isolation rooms in our hospitals. In fact, early enough, prior to the ban, part of our interventions, other than strengthening border surveillance, is the
So
capacity.
you would say
for-
today that all our hospitals have these protocols in place?
Yes, that's right, Your Honor.
So no further questions, Mr. Chairman. Thank you very much. Yes.
Secretary Duque, one suggestion, kindly designate credited isolation hospitals in the province, since provincial hospitals may not be able to properly address this case po.
Will do, Mr. Chairman.
Then next to one question from one governor from Negros to Coast Guard Admiral Garcia. Pwede nyo bang ma-check daw, merong mga nagdadak doon sa Negros from China vessel, and then without a contract po ito. So pwede nyo bang tingnan along with the immigration Chief General Morente, tingnan niyo po yung mga vessel po kung properly documented at para maiwasan na rin po yung
Yes, sir.
pagkalat.
Mr.
Your
Chair.
Honor, sir, Mr. Chairman, basically, sir, yung meron po tayong tinatawag na CIQS, Customs, Immigration, Quarantine, and Security. Part po to ng protocol. Lahat po ng foreign vessels na parating sa ating mga port, nasa anchorage area po yan. Ang protocol po dyan, nasa quarantine po sila at inaakyat po ng Bureau of Quarantine Personnel at saka Immigration, at saka Coast Guard. So makakaasa po kayo, sir, na yung protocol na yan mananatili at sa kasalukuyan, inigpitan po natin yung pagmatyag sa mga foreign vessels na may mga lulang mga foreign crew. Yun lang po, sir.
Thank you. We have to wrap in a few minutes. Go ahead.
Two manifestations, no question.
Manifestation. Okay, go ahead.
Firstly, I think, are there still DepEd representatives? Yeah, a matter of concern has been the announcement that the most vulnerable would be the senior citizens with pre-existing conditions and necessarily young children. It's a matter of observation and fact that the large public schools in the NCR region contain 5 to 10,000 children. They're immensely crowded. They stay there for many hours. There are barely any hand washing facilities, and they also spend time in jeeps, buses, and so on. We have taken no precautions whatsoever to cover these children. Furthermore, it's coming to be Valentine's Day, and any number of concerts are already slated for K-pop and other bands. These are going to contain upwards of 25,000 people in one single venue, many of them Chinese nationals. Are we going to take care of all of these? Please let us be certain that these concerts that should be entertainment and celebration will not end up becoming a tremendous health risk.
Yes, Your Honor, I have been in touch with Secretary Briones, and in fact, yesterday morning, she was asking if for our advice with regard to, say, children going on field trips, and I said, not at the
even
moment.
the children in the classrooms po, it's very, very crowded. They're confined there for hours on end.
We have guidelines that we gave to the DepEd to follow.
Wala naman silang mga mask, wala
Hindi ba
naman
kailangan,
hardly any hand washing facilities.
Well, the hand washing facilities, I thought I heard her say they have. I don't know.
They're fairly meager, as you know, so
okay.
crowded.
So we'll take it up how they can comply with the guidelines of the DOH and address the gaps at their level.
That will be the same situation as well for these exceedingly large concerts that are upcoming in the next couple of weeks.
We will be certainly advising
Will you
the
have
concern.
thermal screening and so on at the entrance of these places?
We might have to forego with the holding of such concerts in the meantime.
No announcements have been made as yet. Finally, Mr. Chair, I've filed a resolution urging the executive branch to provide Congress with an impact risk assessment report of this virus. Unlike Secretary Dominguez and his fairly sanguine prediction, my sense is we will be suffering larger economic losses than he has predicted. It is not merely tourism, which, as he says, is a mere 2% of GDP, but more importantly, the impact, for example, on the POGO, occupying 10% of total office space now in the NCR. Furthermore, our OFWs and the rest. So I urge our economic managers, this is Senate Resolution number 315, to please join us in trying to plan forward with an impact assessment. Thank you po.
Thank you, Senator Amy Marcos. Would like to acknowledge the presence of Senator Gordon. Now, since his arrival, we have to extend up to 10 o'clock in the evening. Swerte kayo, medyo walang gana si Senator Gordon po ngayon. One more last question. We have to wrap up in a few minutes. We have a session at 4:15 in the afternoon.
Salamat, Mr. Chair. Meron sana akong mga kalahating dosenang tanong pa, but in the interest of time, for the record instead. At this point, Mr. Chair, I would like to commend our health professionals and frontline workers from DOH to the Epidemiological Bureau to the Bureau of Quarantine, to our dedicated health workers in RITM and San Lazaro Hospital, our researchers, for taking the lead in our defense against the 2019 novel coronavirus, especially given the public demand and pressure. Salamat po for putting the public's health and safety as top priority. Moving forward, Mr. Chair, I urge the DOH to ensure a fully functional epidemiology and surveillance unit in all local government units, to designate public and private health facilities as points of care nationwide, especially for high-risk groups, and to further develop the PhilHealth benefit package as part of financial risk protection. Whether kasi 14,000 o 18,000 o 16,000 o 32,000, at best, 60% lang siya ng value nung 2003 SARS package. Wag namang po sana. I would also expect our DILG to provide assistance to our local government units, especially low-income LGUs, to effectively roll out collaborative preparedness and mitigation plans, and for concerned government agencies such as DSWD and OWA to develop assistance to vulnerable groups like our OFs. Our experience so far in dealing with the 2019 nCoV has shown the need to develop a strategic response and an overarching national action plan on public health emergencies and international health regulations, and to institutionalize an authority or body, hindi lang task force, with the health sector as a lead to harmonize policies, programs, and plans in the exercise of effective leadership and efficient governance of public health emergencies. Na ayon sa World Health Organization, one of their values in public health emergencies preparedness is duty to care. So ang ganda, no? Alagaan natin ang ating sarili, ang ibang tao, lahat ng tao na magkasakit dito sa atin, Pinoy man, Chino man, ibang nationality, tungkulin nating gamutin. Once again, I join our health authorities in calling on the public to continue to frequently hand wash, avoid close contact with people suffering from acute respiratory infection, and practice cough etiquette. So may GMRC pala sa pag-ubo at sa pag-hatching. So manatili po tayong ligtas, manatili po tayong malusog. Daghang salamat, Mr. Chair.
I'll just ask one question.
One question.
I'll just ask one long question. You know, sometimes one is misunderstood for asking a lot of questions. And I take umbrage when comments like that are made because we're senators. We are supposed to speak up. And when I speak, I think I speak with research, with experience, and I'm not going to waste the time of the Senate, although I came in late, only because I was sick the whole day today. I've been wrestling with stomach cramps for the whole day. Let me just be very brief with Secretary Duque. You have gotten the brunt. Kayo ang binubugbog ngayon dito. The cabinet is binubugbog. Who is binubugbog? The whole world is on a blaming spree. Is that correct?
I believe so, Mr.
China was being blamed for having come out very, very late in conducting a report on what has been happening. There are suspicions that China has been keeping it for a long time. And now that it's out of the bag, people now are blaming. Nobody is very good in these epidemics. I've been reading back again my book on the big influenza, the great influenza. And I think in this particular case, so far the world has been lucky. And if we do it right these coming days, I think we should be able to ride the storm. Who is also being blamed for not being very clear? I think they know that that's part of the job. In an incident like this, it will happen. So I would like to commiserate with all the front liners from the Department of Health. They do their job, but sometimes they just don't have enough resources to look for it. And I think there should be a lot of teamwork with the airport, with the authorities, with the immigration, with with everybody. Dapat magkakasama-sama tayo dyan. Dapat mabilis ang meeting and regularly. We do that in the Red Cross all the time. And that's why I now ask you, do you have a stockpile ng mga mask? Because ang isang malaking problema, hindi naman pa kailangan ng mask dito. Hindi po tama yun? Hindi pa kailangan.
Hindi pa po. Except for our frontline healthcare workers.
Pero sa dami talaga na nangyayari dito ngayon, maraming natatakot sa Chinese, maraming pogo, maraming nababalitaan, ang gusto ng tao lahat bumili ng mask. So ang mask, pinupok natin ang sarili natin sa ulo. Ang mask, 2 pesos, and now it's selling anywhere from 8 pesos to 40 pesos. Is that correct? In other words, ito ay resulta ng takot, correct? And that's where the government should have come in right away. The government should have assured right away that we are going to handle this situation, and we should have looked, and that's why I asked for the stockpile. I had a friend in, may kaibigan ako sa Clark, sa Subic, na lumipat sa Mariveles nung tinanggal ako sa Subic. But he's been helping the Red Cross with body bags, he's helping us with face masks, he's given a donation to Batangas of about 200,000 masks, and again, he's giving another donation. And we were talking with Secretary Locsin. I'm sorry, Secretary Locsin is no longer here. We were talking about supplying at least in Filipinos in working in Hong Kong and Macau. But I understand that the Department of Trade has already talked with him, and we talked last night. That's fine with me. Hindi ito pataasa ng yabang. Get the job done. And so what I'm asking now is, are you prepared to make stockpiles? Because right now, we have run out of masks. And if we don't have masks, it becomes a question of law of supply and demand. No supply, tataas ang presyo. Is that correct?
Exactly, Your Honor.
Yes. Why don't you say that to the public? So now, dapat, we should encourage all these businessmen, yung mga Ayala, yung mga Pangilinan, yung mga ibang mga lalaking tao dyan, magtayo kagad ng mga factories involving not only face masks, but what about the frontliners? Aren't they going to be using, di ba sila gagamit ng mga uniforme nila na isolation gear, yung kanilang tawag doon, isolation uniforms?
It's the hazard materials, your PPE, hazmat.
Hazmat, and the ordinary thing that they wear when they go before the patients. Is that correct?
That's right.
And we're running out of that too, right?
Not at the moment, but we are, the President last night, in one of his directives, we will be procuring 2 billion, 25 million worth.
All right, this is part of my kilometric question. I'm glad you told me that. And I will finish now. Do you have data on which hospitals are in need of supplies? Because I'm getting call from a lot of hospitals asking for face masks. Apparently, they don't have surgical masks, they don't have face masks, and we're trying very hard to get the world to supply us with face masks so we can give it to them. We're working quietly on this. I just have to say this out of concern na kung walang face mask yung mga doktor, ibang disease ang aabot dyan. Is that correct?
Your Honor, but right now we have the inventory that I can submit.
So we're able to make it?
Yes, we have.
That's not what I'm getting, Secretary Duque. You're my friend, and I don't want to put heat on you. Pero alam kong nahihirapan ka na. Pero meron mga hospital na walang gamit.
Can we get the
local
names?
and national?
Yes, yes. Can we get the names?
I will give it to you in private because I don't want them to be embarrassed. All right?
Okay, thank you.
Sino ang bibigyan nyo una ng masks? Di ba dapat ang bigyan nyo una ng mask yung mga frontliners? Yung mga nasa ambulance, yung kukuha? Kahapon kanina, narinig ko si Senator Bong, sabi niya may nakatihaya doon sa isang lasing pala yung Koreano, pero naglagay na kagad ng Facebook accounts, natatarantahan tao. Tama po ba yan? What have we done about that? Are you recommending to the President or to any agency that all this rumor mongering should be stopped right away?
We have coordinated with the.
Sama natin sila doon sa talaga may sakit.
This Facebook, Your Honor, we have coordinated with them to take out all of these baseless, all this misinformation, the virus of misinformation, which is spreading far more virally than the.
I think the Senate and the departments here concerned know what we do not want to happen from our people. What you have to tell them is what we want them to do. In other words, kung may dumating na kaibigan galing sa China, hindi nagre-report, sabihin na natin, dyan ka lang, i-report ka namin, galing ka dyan para hindi mahirap maghanap. I do tracing in the Red Cross. I understand you only have 17% of the tracing. Now, if an airline doesn't cooperate, if other people do not cooperate, then you throw the book at him. Is that correct?
Yes, sir.
Ganun lang naman ako magtanong, yes or no lang, para malaman natin kung anong kailangan natin gawin. Yan lang naman ang alam ko. Hindi naman ako matalino katulad ninyo lahat. So finally, Wala tayong hazmat sufficient. Goggles, gloves, and other protective gear. Now, this is going to be a long haul. May I ask who, for you, is the final question. How long do you think this is going to last? In the 1917 or 1918 big blow, where 100 million to 50 million, depends on who do you believe? 100 million were killed according to them. It lasted for 2 years, right? Is that correct, sir?
Yes.
And how long? This is what they call a novel coronavirus. Everybody takes it for granted. Why is it called novel? Is it because it's new? It's a new strain that we have to attack, that we have to learn from? Is that correct?
That's correct, sir.
So that is the kind of information we need to know. If it is a novel disease, then the public must be made aware this is a novel disease and we should treat it with respect, not with frivolousness, not with jokes, showing sanitary napkins being put on the face of people. And again, I repeat, hindi naman kailangan pang face mask eh. Ang kailangan maghugas. In fact, I would recommend, and I'd like who to answer this, would you recommend that instead of face masks, people keep a supply, not only of face masks at home, hindi na kailangan manghingi sa tao, but they should have also gloves, cheap rubber gloves, so that they don't touch their face all the time, to remind them that they're not supposed to touch their face all the time.
Thank you, sir. With due respect, we don't want to create a false sense of security. The face mask is at this moment advocated largely for people who are symptomatic to prevent the spread of respiratory infections, bearing in mind that this is largely a respiratory infection.
Let me understand clearly what you're trying to say, sir. Are you saying that we need face masks?
No.
No, not for the general public. We want to prioritize the available face masks for those people at risk, for frontline health workers, and for people who have to deal with the general public during their work to protect them.
I think we're on the same page.
Yes.
Somebody with ubo, with cough, somebody with fever, they should wear a face mask.
Exactly, sir.
And anybody, a frontliner, must wear a face mask.
Yes.
What kind of face mask will they wear? N95 or just a sterilized?
Just a normal surgical mask.
Just a normal face mask. So, again, I would like to say that there are a lot more questions to be answered here. I think what is important is after this hearing, we get the things that we have to tell the public so that they will be more comforted. They will not make any other issues other than what has to be answered. For example, I mean, we sent face masks to customs in the first day. Now I have immigration asking me for face masks. I'm not a supplier of face masks. We sent face masks and facilitated the face masks coming from the supplier to China. We did not supply it. It did not come from government funds or from rather Red Cross funds. So I just want to say, if assuming for the sake of argument na hindi tayo nagpadala doon, siguro dadong-ladami yan. We send there, siguro at least we can at least domesticate a little bit more those who will have it. But in the meantime, we should circle the wagons here, prepare to have stockpiles in the future, and let's get the job done. Thank you very much, Mr. Chairman.
Thank you, Senator Gordon. Due to the lateness of the hour and considering that we have a session at 4:15, we have to suspend this hearing. Let me just give a short closing statement. This committee is open to holding another hearing to be scheduled on a later date if necessary. Maraming salamat po sa ating mga resource speakers. Salamat rin po sa mga kasamahan ko sa Senado. Nakikiusap po ako na magkaisa tayo, magkakilala naman tayong lahat, magtulong-tulong na lang po tayo. Ulitin ko, ginagawa natin to para maliwanagan ang publiko tungkol sa issue na to at magrekomenda ng aksyon kung kailangan. I also ask the public to avoid the spread of rumors about the arrival, spread, and management of affected individuals, both foreign and nationals and locals, especially in social media to prevent public anxiety and miscommunication. Unahin natin palagi ang kapakanan, kalusugan, at interes ng bawat Pilipino sa mga panahong tulad ngayon na ikinakakaba natin ang magiging kalagayan ng ating pamilya at mga mahal sa buhay. Dapat mas lalong magtulungan tayo, magkaisa at magbayanihan para sa ikabuti ng bawat Pilipino. This hearing is hereby suspended.